Good afternoon. I'm Dr. Bryn Voix, professor and department head for the Department of Nutrition in the College of Education, Health, and Human Sciences. On behalf of the University of Tennessee and the Department of Nutrition faculty and staff, I would like to welcome you to Promoting Healthy Weight 3.0. Today's topic will focus on creating more equitable food systems. This event is sponsored by the Department of Nutrition and, in part, the Health Resources and Services Administration's Maternal and Child Health Bureau. For this colloquium, we are honored to have a group of researchers and practitioners from different fields share their findings, experiences, and hopes for the future. The goal of today's presentations is to provide family and community members, students, researchers, and practitioners with up-to-date and relevant information from experts in the field on promoting healthy weight through increasing equity and access across the food system. Today's colloquium will begin with a presentation from Dr. Christina Barroso, professor in the College of Nursing here at the University of Tennessee. Her presentation is entitled The Food System, Food Equity, and Cultural Foods. Our next presenter, Erin Beal, is the Program Officer for the Food System Sustainability and Public Health Program at the Johns Hopkins Center for a Livable Future. Erin will present Building Back Better Food Systems, Local Government Planning to Improve Food System Resilience. Then Dr. Megan Schradley, a professor in the Department of Communication and Media at West Chester University, and Dr. Mariela Fernandez, professor in the Department of Parks, Recreation, and Tourism Management at Clemson University, will discuss food insecurity among Black, Indigenous, and students of color in the U.S. Next, Twyla Casadori, a forager, food educator, advocate, and the program assistant for the traditional Western Apache Diet Project for the San Carlos Apache Tribe, will discuss food sovereignty and traditional food. We will conclude the colloquium with a panel of food system experts discussing centering cultural foods and diverse voices. Again, welcome to Promoting Healthy Weight 3.0. Now we'll turn this over to Candace Sapp.
Actually, we're going to have Dr. Betsy Anderson-Steeves introduce our LAC and NAC partners.
Good afternoon. I'm Dr. Betsy Anderson-Steeves. I'm the Associate Director of the Maternal and Child Health Leadership Education and Training Program here at the University of Tennessee. On behalf of Dr. Marcia Spence, the Director of our training program, and our funded trainees, Candace Sapp, Emily Watovich, Katie Bell, Alex Gardner, and I would like to welcome you to the Promoting Healthy Weight Colloquium 3.0. We're thrilled to have an excellent lineup of speakers, panelists, and our always fabulous moderator joining us today. I'd like to thank our local and national advisory committees for their assistance in developing the theme for this colloquium, as well as for helping us identify our speakers. Your support and assistance are vital to the success of this and all of our colloquia. Additionally, I'd like to thank Candace Sapp, our lead trainee for this colloquium. As you'll note, we have a new platform. We hope that this new platform will work seamlessly for our colloquium today. Would also like to thank Candace for her efforts to make sure that our leadership team and that our speakers had the opportunities to practice and prepare for using this new platform. Candace will now provide some logistics for our colloquium today, and she will also introduce our first speaker. Candace, back to you.
Good afternoon. My name is Candace Sapp, and I use she, her pronouns. I'm a maternal child health nutrition trainee and doctoral student at the University of Tennessee, Knoxville. Before I go into the logistics of this webinar, I'd like to first acknowledge the land that we live and work on, which was stolen from the Tsalagi peoples and the Soya peoples and later forcibly worked by enslaved Blacks. Those injustices affect BIPOC communities even into present time and directly affect food equity, which you will hear our speakers and panelists discuss in detail shortly. As far as logistics, we have enabled live transcript for all attendees and panelists. You have the option to choose to use it on your end. Attendees are also able to communicate with hosts and panelists through chat and the Q&A function. We ask that you use chat for technical and administrative questions for the host and reserve Q&A box for questions for speakers and panelists. Also, feel free to email utphn@utk.edu if you need technical or administrative support. The email will be placed in the chat for everyone's convenience. With that in mind, I will introduce our first speaker, Dr. Christina Barroso. Dr. Christina Barroso is an associate professor in the College of Nursing at the University of Tennessee, Knoxville. And personally, she's also one of my committee members on my doctoral committee. Thank you for that. Her research focuses on Latino and African-American communities, and she looks at health disparities specifically related to physical activity promotion, nutrition education, and obesity prevention. She will be giving an overview of food systems, food equity, and cultural foods. Without further ado, Dr. Christina Barroso.
Dr. Barroso, you're muted.
Of course I would do that. All right. Hello, everyone. I'm excited to be here with you today. We will cover 3 key terms in this brief presentation. By the end of this session, you'll be able to define food system, food equity, and cultural foods. When we think of foods, especially produce, and where to purchase them, most of us think of grocery stores, supermarkets, or perhaps farmers markets, or some other vendor, as most of us do buy our foods from these retailers. But what about the production of our food? When we think about food production, we may think of farms, ranches, fisheries. Production and retail are 2 key components of the food system. Other sectors, including processing, distribution, and recovery, recycling, and waste disposal, are also parts of a food system. Let's think about how our foods get on our tables. What steps are involved in getting dinner on the table? In this instance, dinner consists of pasta, broccoli, shrimp, and a cream sauce. The broccoli could come from local farmers here in Tennessee, or perhaps grown in California, Arizona, Texas, or even Oregon. And it could be harvested by seasonal farm workers, often individuals who come from Mexico and Central America. The shrimp could come from farmed shrimp from Texas or Alabama. The shrimp could also be imported from Southeast Asia or Central America. Or if the shrimp is wild caught, it could come from one of the many states along the Gulf of Mexico. What about the cream sauce? The milk used to make cream could come from a local farmer or from a dairy operation in the Midwest or elsewhere. The dairy operation may even involve over 500 cows milked several times a day by robotic systems. All of these ingredients were then shipped by truck and or rail to a processing plant. They could have been sealed in containers, probably made of plastic and not environmentally friendly. Cases of the food were then delivered to distribution warehouses and finally to a retailer, in this case, a supermarket. These ingredients, as well as all food, takes a complex journey from farms, ranches, fisheries, and waterways to our plates. All the while, this journey to our plates encounters limited natural capital, such as soil, fresh water, and the countless organisms that contribute to our food supply. Our food will also pass through the hands of farm workers, food safety inspectors, warehouse managers, shippers responsible for transporting food, grocery store owners, and many others involved in the production, processing, distribution, and retail of food. How food gets to our plates are decided by business owners, scientists, policymakers, and consumers. People, activities, inputs, outputs, and outcomes involved in getting our food onto our plates are all part of the food system. So what is a food system? A broad definition of a food system includes all of the actors and drivers who influence what we eat. This includes their inputs, outputs, interactions, and outcomes, which occur between and within biogeophysical and human environments that determine the activities within a food system. These activities are the production of foods, which involves a vast network of farms, ranches, and fisheries that cultivate food and use limited natural resources. The processing of foods, where agricultural goods are transformed into a variety of food products for consumption. The distribution of foods by land, air, or sea. The retail of foods, which encompasses all kinds of stores, venues that are direct to consumer, such as restaurants, food trucks, and many other models that transact the sale of foods to consumers and customers. And the recovery, recycling, and waste of foods, which involves municipalities, companies, nonprofits, and others who handle unused, discarded, and expired foods throughout the supply chain. It is important to note that all these activities or sectors are interconnected and interdependent. They all contribute to the food equity, environmental security and equity, as well as social welfare and other determinants of food sustainability. For this reason, sustainability, in my definition, is highlighted in purple, as our current food system is not sustainable, equitable, nor inclusive. Three factors that influence sustainability, equity, and inclusivity are policy, environments, and cultural norms. Food systems are dynamic, and change comes from both external and internal forces within a food system. The need for change comes from population growth, as well as climate change and loss of biodiversity, as well as urbanization and innovation and advances in technology, as well as fluctuations in trade and in the market, and also food preferences and other developments. Hence, policy, environments, and cultural norms about how things are done and why things are done, both within and outside of food system, impact what we eat and our health. Here's a schematic to help visualize the various systems within a food system, as well as how it impacts population health concerns, such as nutrition-related chronic diseases like obesity, diabetes, cardiovascular disease, and some forms of cancer. Our food choices, which are based on policy, technology, culture, and other influences, drive agricultural practices that affect the air, water, soil, biodiversity, and other threatened natural resources. Our food choices are more than just environmental concerns. They are public health concerns because they affect all aspects of everyday life, and because human civilizations and the long-term viability of our food supply depend on natural capital and a stable climate. The food industry is a $1.8 trillion enterprise. It employs almost 1 in 7 workers, and for the average US household, it is the 3rd largest expense after housing and transportation. The inputs, outputs, interactions, and outcomes of a food system can transform the built and natural environments and impacts our health. The current food system is inequitable, exclusive, and not sustainable, all of which threaten our health and the economic well-being of our communities. Benefits of our food system do not reach far too many people, in particular low-income individuals, people of color, and people living in rural and tribal areas. Although people of color make up a large portion of food workers and food consumers, and they bear a disproportionate burden of poor health and economic outcomes resulting from the structural inequities within the food system. For example, almost 40 million people live in areas with limited access to fresh, healthy, affordable, and culturally significant foods. Furthermore, more than 21 million workers across the food system have substandard working conditions and earned wages that are so low that they cannot buy the very food that they grow, harvest, deliver, or serve. Hence, there is much work to be done in advancing equitable food system goals. One way to show how complex interactions within a food system influences a person's health is through the social ecological model. A key ecological perspective is the emphasis of the interaction between people and their physical and social cultural surroundings. From their individual health behaviors to their interpersonal activities, to their social networks of peers, organizations, schools, churches, work sites, to community settings and public policy. All of these impact the food system and the environment. Hence, equitable food systems are driven by evidence-based outcomes that support nutrition, health, safety, and economic stability for all. They would be productive and efficient. They would deliver affordable and culturally significant food. They would be environmentally sustainable and climate smart. And most importantly, they would be inclusive to all. For our food system to become equitable, we need continued investments made throughout the system and within each level. Investments in agricultural research and development, investments in infrastructure support to support climate smart transportation, investments in marketing of healthful and culturally significant or meaningful foods, just to name a few, all of which are influenced by programs and policies that should be based on sound evidence. Innovative policy changes throughout the food system can help eliminate food insecurity and make the food system more equitable. At any given time, about 1 in 7 US households experience food insecurity. This is about 37 million people, including more than 11 million children. Food insecurity is a lack of available financial and/or social resources for food at the household level. It is more than hunger. Hunger is a personal physical sensation of discomfort. Although food insecurity does not necessarily cause hunger, hunger can be an outcome of food insecurity. Food insecurity is influenced by economic stability. Food insecurity is a disruption of food intake or eating patterns because of the lack of money or other resource. It can involve worrying about how to replenish food when it is depleted, going hungry because there's not enough money to buy food, and relying on food banks or soup kitchens for food. The USDA divides food insecurity into 2 categories: low food security and very low food security. Low food security is reduced quality, variety, or desirability of diet with little or no indication of reduced food intake. Very low food security is multiple indications of disrupted eating patterns and reduced food intake. US federal food and nutrition assistance programs like the Supplemental Nutrition Assistance Program, or SNAP, also known as food stamps, and the Special Supplemental Nutrition Program for Women, Infants, and Children, or WIC, help low-income families put food on their tables. Food insecurity is not just a national problem, it is a global problem. Worldwide, malnutrition is responsible for nearly half the deaths of children under 5. However, eliminated food insecurity will require a systems approach, as we are currently experiencing an inequitable food system. Numerous food workers and servers, as I mentioned before, often low-income people and people of color, experience poor labor conditions, earn lower wages than other workers, and live in communities with limited access to healthy foods, and often cannot buy the food they participate in growing, harvesting, delivering, and serving. For food equity to occur, which is when all people have the ability and opportunity to grow and or consume healthful, affordable, and culturally meaningful foods, food systems must be controlled democratically, and community members, including consumers, must determine the policies that influence their food system. Increasing agricultural production alone will be insufficient. Cross-sector policies with the buy-in of local stakeholders, for example, farm operators, as well as national and international influencers are needed. Hence, a system approach to foster and achieve food equity will require policy changes across the various sectors of the food system, from production to processing to distribution to retail and recovery, recycling, and waste of foods. A systems approach is needed to advance access to nutritious, culturally meaningful or significant foods. Culturally meaningful or significant foods are foods or dishes that express customs or traditions, beliefs, attitudes, values, and manifestations of an ethnic group, religious body, geographic region, or cultural community. Cultural foods are typically passed from generation to generation. They involve beliefs about how certain foods are prepared or used. They play a role in celebrations. They help to establish and or strengthen familial connections. And they can be a fusion of traditions. In short, cultural foods establish identity or identities. An example of the fusion of traditions is the overlap between Southern food and soul food. Although soul food is Southern food, not all Southern food is soul food. The overlap comes from the fact that enslaved African people were given meager rations for sustenance, but were also expected to grow, harvest, and serve food to their captors. Hence, the enslaved African people prepared and served their captors foods like what they ate. And how that's some of the beginnings of soul food and Southern food. But why should we care or be concerned about cultural foods? And what role do they play in food equity and food systems? Culture influences the experience, expression, course, and outcome of all health problems. Culture also influences health decisions and help-seeking behaviors. Culture determines how people respond to health promotion, prevention, or treatment interventions. Similarly, culture plays a role in what foods are acceptable and what foods are cultivated, how foods are prepared, and how foods are used. Therefore, we must address culture and its roots in food equity and food systems. The fields of health promotion, health education, nutrition, and dietetics, just to name a few, still have a lot of work to do to ensure cultural competence. One area that could benefit from cultural competence is how we define healthy eating, particularly the inclusion of cultural foods into what is considered healthy eating. My plate is a visual depiction of the USDA dietary guidelines and is based on the Dietary Guidelines for Americans 2020 to 2025. The different shapes of the plate is a reminder for healthy eating, and the use of the word "my" reminds consumers to personalize their dietary intake. My plate emphasizes the importance of a healthy eating routine throughout every stage of life and reminds us that at every stage of life, what we eat affects the next. It emphasizes an importance of a variety of fruits and vegetables, grains, protein foods, and dairy and fortified soy alternatives. Although cultural foods can follow dietary guidelines and are a part of healthy eating, what needs to be improved is the use of cultural competence and other resources to help professionals and consumers understand how cultural foods can facilitate the application of these guidelines and how their promotion and use can help realize food equity. To illustrate how food inequity and an inequitable food system impacts other aspects of life, here is a quick snapshot of a recent news report by NBC News. In this report, climate change, a possible outcome and output of an inequitable food system, is believed to have contributed to the onset of a drought in Guatemala, which then potentially caused maize or corn to not fully grow. The man holding the maize is a farmer who is experiencing food inequity and food insecurity, and he is now considering migrating to the US in order to feed his family. An inequitable food system impacts all aspects of our life. To summarize, a food system is the sum of the actors and drivers, their inputs, outputs, outcomes, and interactions. Food equity is when all people have the ability and chance to grow and or consume healthful, affordable, and culturally meaningful foods. Finally, cultural foods represent the traditions, beliefs, and practices of an ethnic group, religious body, geographic region, or cultural community. Here are some resources on food systems and food equity. Thank you for your attention.
Thank you so much, Dr. Barroso. We have just a few minutes left to ask some questions. We had several from the audience, so I'm just going to ask one. What type of strategies can public health practitioners utilize to begin involving youth in understanding and working to improve our food system for the future?
Well, thank you for the question. Well, there are many strategies, but I think the first thing is to begin to empower students, children, to believe that they are owners of their community so that they can voice their opinions and their concerns. So I think the first thing is to really help empower them so that they can find their voice.
I agree. And definitely starting early, because they don't have to wait until the future to make a change. They can make a change in the present time also.
Children have a lot of weight within their families. And so if we help to empower them, they can begin to be the change that we need to see for tomorrow.
Awesome. Thank you. I'm going to give you one more question and then we'll move to the next speaker. If you could encourage viewers to advocate for just one policy that would improve our food system, what would you ask?
I would say start local. And I think that would depend on what your local community needs, because it's not a one size fits all type of deal. And so we need to think about what would be best for the community that we live in. And you are your best expert for that. So I would say start local, find out what's happening in your community, and then do what you think you can do to make a change.
Thank you. Like you said, that's so important to know what your community needs. So as practitioners and researchers, we don't need to just go in assuming that the community needs what we want to deliver. Awesome. Thank you so much, Dr. Barroso. We really appreciate this overview, and we're going to turn it over to our next speaker and trainee introducing them. Thank you.
Hi, everyone. It's my honor to introduce Miss Erin Beal. Erin is the program officer for the Food System Sustainability and Public Health Program. In this role, she coordinates research, policy, and outreach activities related to the program's 3 focus areas: reducing wasted food, supporting urban food system resilience, and connecting diet and climate change. A Yooper from Michigan's remote Upper Peninsula, Erin grew up with a hearty appreciation for the outdoors. She earned a BA in public policy from the University of Michigan and focused on environmental policy. With her growing awareness of food's vital connection to environmental sustainability, she joined AmeriCorps in 2011 and implemented farm to cafeteria programs as an environmental educator at Phoenix Charter School in Roseburg, Oregon, and is a farm-to-table coordinator at Camp Corey in Carnation, Washington. In 2013, Erin returned to school to earn an MS in public health from the Johns Hopkins Bloomberg School of Public Health with a focus in human nutrition. During her graduate studies, she worked with Johns Hopkins faculty to evaluate a school-based nutrition education program in New York City public schools. Through the U.S. Borlaug Fellowship in Global Food Security and the Nutrition Innovation Lab in Asia, she researched the cost of nutritious local diets in rural Nepali communities before completing her degree in 2015. Although Erin spends most of her time thinking about cooking and eating food, she also enjoys playing music, hiking, and swimming. Please welcome Miss Erin Beal.
Thanks, Katie, for that introduction. And thank you all for having me today. I'm going to share my screen. If you just give me screen sharing abilities. Okay. All right. All right, are you all looking at my slides and not the notes?
Looks good.
Okay, great, thank you. So again, thank you, Katie, for the introduction, and thank you, Dr. Barroso, for giving such a great overview of food systems and equity. And I'm really excited that you've covered so many important issues with food systems, and I can kind of jump off of what you've said. So this is really exciting. So as Katie said, I am a program officer at the Johns Hopkins Center for a Livable Future. And if you're not familiar with the center, we are an interdisciplinary academic center located within the school's public health in the Department of Environmental Health and Engineering. And at the CLF, we work on a variety of research, education, and communication initiatives, all at the intersection of public health, food systems, and the environment. And as she said, I work on three primary areas with research and policy, but today I will be sharing some of my work related to food system resilience and some of the work we've been doing with local governments on this topic. So the objectives of today's talk are to describe how climate change and pre-existing inequities disrupt food systems and food security, to apply resilience concepts to food systems thinking, to explore ways to enhance equitable food system resilience to climate change and other crises, and then to highlight some examples of local government efforts to build food system resilience. So you just heard a very similar definition of food systems, but in case you're just joining us now, when I'm talking about a food system, I'm talking about all of the activities and resources that go into producing, distributing, and consuming food, the drivers and outcomes of those processes, and all of the relationships and feedback loops between system components. So basically everything involved from making sure that food gets from the farm to the table and sometimes to the landfill when it's wasted. And this is a graphic that I think is actually maybe came out of the one that Dr. Barroso shared. So just to reiterate that food systems are complex, and there are a lot of things going on within a food system, and they're influenced by internal and external drivers. And so today I'm going to focus on climate change as one of those external drivers that impact food system outcomes, including health outcomes as well as environmental outcomes. So why am I focusing on climate change? Well, you may have heard in the news recently that the Intergovernmental Panel on Climate Change, the IPCC, which is a group of scientists who kind of pull together all of the latest research on climate change and publish it, came out with a new report. And this report basically said, climate change is here already. We're already experiencing the impacts of it, from severe weather that we're seeing, changing temperature patterns, a whole range of things. That it's here, and it's here to stay. Some things that change with climate change are not necessarily easy to reverse. So basically we're dealing with a different world than what we dealt with decades or centuries ago. And the world that the environment in which we, as humans, started to practice agriculture and raising livestock for food, that environment is changed. And so our status quo has changed because the climate is changing. And the ways that we have dealt with these disasters and different crises in our food system is also changing. And so what we're looking at, and what I'm looking at, is how do we ensure that our food systems are able to adapt to climate change and other crises, but also still how can we work towards those goals of being more sustainable and equitable that you heard about in the previous presentation. So I work on food systems and, focus a lot more on the consumer end of this topic. But I just wanted to throw up this slide from a recent study that looked at how many different research studies there were examining the impacts of environmental disruption on food supply chains. And the two graphs here basically have, on the vertical axis, the number of research studies that focused on a topic. And then the x-axis is kind of the different topics along the food supply chain. And as you can see in this figure, there's a pretty overwhelming number of studies that have focused on food production and the impacts of environmental changes on production of food, but not much on the rest of the food supply chain and the food system. So, and when we look at climate adaptation in relation to food systems and thinking about resilience, we see this again and again, where people think about producing food without adequately covering all of the other aspects of our food system. So I'm going to do that today and focus on the other aspects of our food system and try to help kind of fill that gap a little bit. So some of the work that we're doing at the Center for a Livable Future focuses on climate impacts to food systems, like I said, from the consumer end of the supply chain. And in particular, we're interested in understanding how these climate-related events can impact a food system's ability to ensure food security. That is not the only outcome that we want to see from a food system, but we think at a minimum, everyone should be food secure. And you already heard the definition of food security, so I won't repeat that, but I want to point out so that the wheel diagram that's here on the right side of the slide is something that we came up with some other researchers from around the US as part of the National Food Access and COVID research team. And so we've been administering some surveys about how COVID has been affecting or potentially impacting people's access to food and their food security. And so we've really tried to demonstrate that there are different components that contribute to a person or a household's food security status. It's not just about having enough food produced, and it's not just about being able to afford that food. There are a number of different things. So I'm going to just try to quickly go through different ways that climate change in particular is expected to impact these different components of food security. So that first component on the wheel is food availability. And this is where the production element comes in, but also distribution of food. So with a warming climate, we expect to see increased temperatures, changes in precipitation, new and migrating pests and diseases that affect certain crops, and also heat stress on livestock production. And so these things can all affect the actual amount of food that we're able to produce. Although currently, as Dr. Barroso, I think, said, it's really not right now an issue of how much food we're producing, but how it's being distributed and people's access to food that is causing food insecurity. But in the future, we will also be having to think about how do we actually produce more food as well. But also with these more severe weather events and precipitation, we expect to see and are seeing disruptions in distribution networks. So most of us in the US don't grow all of the food that we eat right next to our house. We rely on pretty complex supply chains. So any kind of event that disrupts that has the potential to disrupt the food from getting to where we are. And then another component is food access. So even if food is available, the loss of livelihoods and income, like what we've seen during the pandemic for many people, as well as migration due to conflict, can disrupt people's ability to afford the food, even if it's there. And also price increases and kind of fluctuating prices can also have an impact on people's ability to access food from an economic standpoint. But then we in the US, I think a lot of the challenges and reasons why we see food insecurity in the US is economic. But with these increasingly severe weather events that we expect, physical food access could become more and more important as something that's preventing people from getting food. So not only because it might block people's paths to, where they go to the grocery store, but if you live in a community where you don't have any grocery stores that are in walking distance and you're snowed in, or you don't have a car to drive somewhere else, if you go to a store and they've run out of an item that you need, but you don't have the resources and transportation to go to a different store to find that, then there's an access issue, even if there's food available in a different store. And unfortunately, in many communities, especially in urban areas, this issue of having healthy food access and transportation to those food outlets is a challenge. So, and then another aspect of food security is food utilization, which is more about if we have food and we have access to it, is it safe to eat, and is it providing the nutritional content that we need to be healthy? And again, with climate change, we expect to see water scarcity and some changes in the growth of different pathogens that can kind of spread through our food and water systems that could make food unsafe to eat. But we've also seen research recently, kind of talking about how certain crops like rice could actually have decreased nutrient quality because of increased carbon dioxide in our atmosphere. So even if we are able to produce enough food, the nutritional value of that food may be decreased. So that's another thing to consider. And then finally, an important but often overlooked aspect of food security is this idea of food acceptability. And so this is really just talking about in an emergency and in an everyday situation, it's important that people are empowered and able to make their own choices about the food that they eat, and the food that is available and accessible is culturally appropriate and religiously appropriate. And it's more about kind of people having the agency to make the decisions they need in order to be food secure. And then before I move on to the next section, I just want to highlight here with this slide that many of the people who are most likely to be negatively impacted by a food disruption due to climate change are often the same groups of people who may be more likely to bear the biggest burden from other climate change stressors and from health crises like COVID-19. And so when we, and also in addition, food system workers, like as you heard in the previous presentation, many food system workers also may be experiencing food insecurity while being more exposed to high heat situations that could affect their health if they're working outside. So there are some people that are much more at risk of having negative health outcomes, because of these disruptions and because of climate change. And so when we think about how best to prepare for these crises and respond and recover, it's important to make sure that the actions we take are supporting communities who might be in these positions of vulnerability. And that can be done by thinking about how we're distributing resources to help people prepare or respond, and then how we're addressing some of the underlying structural issues that have led to certain groups being marginalized and at a disadvantage in these situations. So, what do we do about all of this? I briefly mentioned, how do we prepare and respond to this? So I'll kind of switch over into talking about how do we adapt ourselves and our food systems to climate change, and how do we do that in a way that is also building a healthier, more equitable food system and not returning to the status quo that, as you heard in the last talk, isn't serving everyone well or in the same way. So this is where I talk about resilience. So resilience is a word that you've probably heard a lot lately in relation to the pandemic. It's kind of a buzzword. It's maybe greenwashed a little bit, and depending on who's talking about resilience, you might hear a different definition or a different critique of it. And resilience is a concept that's present in many different disciplines, from engineering to psychology to health systems. And depending on the discipline of the person talking about it, you might get a different understanding of it. But there are some common elements of resilient systems, and in particular, when you look at a food system, or when you look at a system like a food system that is socio-ecological. And so where you have an interaction of people and nature and the environment and infrastructure and all of these things together, it's very complicated. And so you kind of need a nuanced approach to resilience and how we're talking about it. So this slide has one definition of resilience from the Stockholm Resilience Center. And that is the capacity of a system, be it an individual, a forest, a city, or an economy, to deal with change and continue to develop. And the goals of a more resilient system are to learn from something, a crisis, to be able to adapt to it, and if needed, to actually transform, and hopefully transform in a way that is improving that system in the future and not just returning to a status quo. It also assumes a disruption will occur, and that you're not always going to be able to predict what that disruption is or when it will come. So it's about kind of building your capacity to deal with a lot of different crises, and not just one. And then I want to be clear that resilience is often kind of used interchangeably with sustainability or stability even, but they're not the same thing, because sustainability is more about making sure that our actions now don't compromise our ability to feed ourselves in the future. And it's kind of about continuing our system indefinitely, but it doesn't really incorporate how you can respond to a challenge. And stability is like resilience, but kind of used more in an engineering sense, and is really more about how do you kind of minimize the impact of a crisis on your system, and how do you get back to the normal? Like, how can you quickly bounce back? But it's not really incorporating that need to bounce back better, as you may hear. So I just want to kind of lay out those terms and kind of clarify some of that. So let's put this all together. So food system resilience, also different ways of defining it, but this definition by Tendall and colleagues is that it is the capacity over time of a food system and its units at multiple levels to provide sufficient, appropriate, and accessible food to all in the face of various and even unforeseen disturbances. And you can kind of see some similarities in there in the wording to the idea of food security and trying to make sure that this system that is, overcoming a crisis is still able to provide food in the correct way to all of us. So how do we actually know if a food system is resilient? Well, it's difficult to measure because resilience is latent and it's something that is demonstrated after a crisis occurs. So you can't really say, you can't necessarily measure resilience before a crisis. But there are different ways of thinking about it and different indicators within food systems that can kind of get at how resilient we think a system could be. So the image on the slide here comes from an article from 2019 that put forth a framework for assessing the resilience of a farming system. So it was more specific, but I really appreciated the way that they laid out how to think about this complex topic. And so basically, if you're thinking about trying to understand resilience in a system, there are these 5 questions. First one being resilience of what? What is the system in question? Resilience to what? What are you worried about disrupting your system? For what purpose are you doing all of this work? And what is the function of this system and your goals? What capacities can you see within the system that might build resilience? And then what different attributes in the system can enhance those capacities? So I'm going to go through just kind of some examples of what this all means. And I also want to just show that this is another way of looking at it because resilience, like I said, is something that you kind of see over time. So you might often see this graphic where the x-axis is time and the y-axis is the level of food system functioning. So if we're measuring food system functioning by the level of food security, at any point in time, you have X% of your population that is experiencing food security. And then when there's a shock or a longer term event that disrupts their ability to get food. And then over time, depending on different elements of your system and your community, you can either absorb this crisis, you can adapt to it, or kind of use the opportunity to transform the system into something new. So what does this kind of look like in real terms, I guess? So if you think about the example of a food bank that distributes food to communities, if you're trying to understand would it be robust and would it be able to absorb a coming winter storm, for example, you could ask how much food do we have on hand at any given point in time? And do we have enough kind of backup food supply that if our distribution trucks don't get to us, we can still hand out food? Or you might say, do we have a generator so that even if the power goes out, our operations will continue and we will be able to absorb that disruption without stopping what we're doing. If that doesn't work, that first line of defense doesn't work, then you can think about adaptive capacity, which could mean asking, can we adjust our hours of service or delivery method? Can we make some changes within the way we currently do things that can adapt to this situation? And then kind of the next step, these things kind of can happen together or as a linear process, but if you're not able to absorb the threat and you can adapt, or it's not enough to just adapt, a way to kind of be transformative and support transformative capacity would be to then say, can we eliminate the need for a food bank altogether? There are too many people in our community who are food insecure, and it's not enough just to kind of deal with short-term emergencies, and we need to transform our whole system in a way that means we don't even need to be here. So those are kind of different capacities that can kind of support resilience to an event. And then, like I said, there are different attributes within a system that you could look for and try to see, oh, this might support resilience to a crisis. So that could be diversity and redundancy. So having a variety of different food sources in a community, whether it's farmers markets, grocers, supermarkets, kind of having a variety can kind of reduce the risk of having all of your food sources closed because of one event. And in a similar way, having redundancy or kind of more than one of the same thing can provide backups when you need them. Also, being connected and connectivity across the system is important. So what we've seen during the pandemic, for example, is that some of the local governments that I've been working with have played a role of coordinating different efforts across their cities by nonprofits and businesses to kind of make sure people have food. And so they're kind of serving as a connector of different agencies and organizations and community members, and making sure that communication in a time of crisis is fast and efficient, and that it enables you all to respond in a coordinated way. And then other things like social capital and political capital can also support resilience. So I like a good example of social capital would be if you have a neighborhood where everybody knows their neighbors and there's a high level of trust between neighbors, and everybody who is able to go to the grocery store and get food to prepare for a hurricane, for example, also then take some food to a neighbor who is homebound and can't get it themselves. So there's social capital where at a very local, individual community level, people can help each other out. And then other things like flexibility and preparedness are also important and can contribute to more resilient outcomes in a system. So I often talk about building food system resilience, and that's kind of what you hear, and you might hear a lot about how we need resilience or we need more resilience. But we need to be careful when we're talking about that, especially as people working in food systems and public health, because not everything about a system or not every system is something that we want to continue indefinitely. While we would like to have everyone be food secure indefinitely, the system might not be able to do that, and therefore we need to make some changes. And I like this kind of definition here of resilience management because it involves actively maintaining or enhancing aspects of the system that are more desirable and meeting the goals of our system that we want. But then it's also seeing what isn't working and saying, okay, we don't want this to be as resilient. Could we let that part fail and replace it or transform it into something better? And then, of course, always kind of increasing this general capacity to cope with different situations. And some kind of, I guess, examples of what this looks like would be if you think about the US food system, which is very complex, but also very efficient and pretty robust, I would argue, because early in the pandemic, when we had kind of shortages of certain food items, the entire population didn't run out of food. So there were some things that were still working in our supply chain, and they weren't entirely shut down. And our supply chain is also very connected, and things are very efficient. And so we can get food to our grocery stores and other food outlets relatively quickly, even when they come from very far away. And so we have a lot of variety in the United States in the supermarket, and we have food that comes from all over the world. Which can be beneficial for having, dietary diversity and getting different nutrients from different foods. But there are a lot of undesirable attributes about our current food system. As we saw with COVID, it's vulnerable to labor disruptions. It relies on a lot of people to produce, package, distribute, prepare our food. And a lot of the people working in our food system, as you heard earlier, do not make a living wage, and they don't have strong occupational health protections. And so when we had the situation where meat processing plants were closed because of COVID outbreaks, we actually did see meat prices go up and kind of ran out of certain things. And so that was kind of definitely showing, yeah, there's a vulnerability here, and it's kind of related to how we're treating our workers in a way. And then our current system, we produce a lot of food, but I would argue that it's not necessarily designed to support human or animal health outcomes for the most part, and it's not necessarily supporting equity, as you heard before. So there are a lot of things that we, I think, need to think about how to transform instead of just propping back up after the pandemic and continuing as usual. So now I'll transition over to what are we actually doing about this? So we understand, we think, what food system resilience could look like in a very theoretical sense. But what are we actually doing to change systems in a local level in the US? So we've been working with a handful of cities around the US to figure out how to integrate food systems better into their climate adaptation plans and their disaster preparedness plans. And so these urban plans then kind of can inform the policies and the work that a city does for the years to come. So we're trying to figure out how can we help cities think more about where food fits into their planning and how they're looking towards the future. So this work that we're doing actually all started several years ago now, back in 2015. In Baltimore City, there was some civil unrest that was as a result of the death of Freddie Gray while in police custody. And that event was not a weather-related event. But there was some disruption, and there were curfews in the city at night that the mayor put in place. And so some of the food retailers in the city couldn't get food deliveries coming into the city because their deliveries were at night. And so there were just some things like that were not expected, I guess, in different ways where people weren't able to get their regular food sources. And this was very short term, but it kind of helped the people in the city and the Office of Sustainability realize that they weren't necessarily prepared for a disruption like this. So they partnered up with the Center for a Livable Future to do a project where we looked at the resilience of Baltimore's food system and interviewed people around the city and from different components of the food system and communities, and came up with some recommendations for how to address and prepare for these disruptions, weather-related, climate-related, social, economic disruptions. Tried to figure out what is the role of the city government in supporting food security in these situations, and what are some longer-term goals and policies that we can enact to support longer-term resilience in the system, while still addressing these underlying issues that are leading to inequity in the communities. So one of the outcomes of that work that was led by the city was they put together an emergency food working group and pulled together dozens of people from different sectors around the city and came together and said, okay, if we have a crisis, what are all of our different roles? What do we do? And that kind of resulted in an emergency food response plan that they then proposed kind of adding to the city's emergency operations plan. And they actually, as they were forming this group, we had a huge snowstorm hit the city, and they kind of had to bring the group together as it was being formed and kind of test it out, I guess. And it was useful to have all these relationships formed already. Another outcome of the work in Baltimore was, as I said, these longer term considerations of food system resilience and kind of recommendations on what the local government could do. And so we looked at the different vulnerabilities within the food system in terms of how different events would be more likely to impact different aspects of the food system. And then we came up with recommendations that were basically tailored towards how do you ensure that you can support food security through these different components of economic and physical access and availability, acceptability. How can we build social capital? So we had a whole list of recommendations that they then took and kind of integrated into their sustainability plan, as well as their work now during the pandemic. So from that work came Baltimore's ability to respond to COVID-19. And not saying that our work was like the reason they were able to respond, but the work we did starting in 2015 was very helpful in kind of preparing the city for what to do when the pandemic hit. They weren't thinking about a pandemic specifically beforehand, but by having a group of people from across the city already kind of in a network and familiar with each other and kind of laying out different roles ahead of time of what they would do in a crisis, Baltimore City was able to, I think, fairly quickly kind of enact their emergency response in the short term. And so they came up with a plan that is shown here on the slide. That's just their strategy to improve nutritional security and minimize hunger during COVID-19. And so the city has been coordinating with the Emergency Operations Center. They've been using data and mapping to kind of pinpoint different areas in the city where maybe more food assistance is needed. They've been overseeing the distribution of food boxes to different communities. They've been trying to leverage funds and actually got funding from FEMA to support some of this work as part of the COVID mitigation work in the city. And they expedited the rollout of online SNAP so that people could access SNAP benefits or food stamps without having to go into the store and kind of put themselves and their families at risk of COVID. And then they also convened a group of resident food equity advisors, which is an advisory group of residents who they meet with and kind of check and talk with the advisors about, are we doing the right thing for our communities, and kind of get input there. And then they also included aspects for kind of more long-term supporting urban agriculture and local food system resilience. So that's where Baltimore kind of is now. And the city was one of the first cities in the US to really take on this issue of food system resilience. And although there were, a handful who had done this, like Boston and New York City had been looking at their supply chain resilience and so on. But since Baltimore was one of the earlier cities and we had done this work, we got interest from other cities and other communities saying, how do we do this? So a couple of years ago, we got funding to build a food system resilience community of practice. And the goal of this community of practice was to work with a handful of other cities to co-create some resources that they could use to understand and plan for resilience in their food systems, but also that other local governments and food system policy councils and so on could use to kind of start thinking about what does this mean to build food system resilience and how do we do it in a way that does build equity. So that was kind of a key objective of this working group. We also just wanted to build a network of cities who are working on this issue because it's very new to a lot of local governments. And as researchers, we also wanted to monitor and evaluate this whole process and see, is this kind of shared learning and co-creation model effective at improving the knowledge of these local governments and their efficacy as well. And then we started this community of practice at the same time as the pandemic really hit the US. So it ended up also being an opportunity to provide a shared space for learning for these government staff during the pandemic. So we worked with Baltimore City as well as 4 other cities, including Moorhead, Minnesota, Denver, Colorado, Austin, Texas, and Orlando, Florida. And we recruited these 5 cities because we were trying to get a mix of cities and government types and also kind of get different geographic representation, thinking that different hazards would be more likely to affect these different cities. And also, these were cities who had expressed interest in working on this topic and really wanted to get involved in this. And I'll kind of pass through this, but basically, we based our recruitment on getting a variety of different types of cities versus getting like the same type of city at the same stage in their planning process. And the people who joined the community of practice, there were 11 people total, so about 2 to 3 different people from each city. We tried to keep it small to encourage a lot of conversation. And they were from all different types of departments within local government, as well as a university extension member, a city council member from one place, and they had a number of different roles within their local governments. Some of them were kind of food-focused people, and some of them were health or disaster-focused people. So it was quite a mix. And then so basically what we did was we held 6 monthly calls with these cities over between April and November of 2020. So like I said, right as the pandemic was happening, was beginning. And we did a baseline survey at first just to get a sense of their kind of existing knowledge of food system resilience and what they were doing already. And then we had these 6 different calls that were focused on different aspects of food system resilience planning, from, who do you bring on to your team to do this planning work, kind of what are the different risks in your system, and kind of thinking about different strategies they could use. And then we had 2 workshops to do like deep dives into some specific topics. And then did an exit survey and some in-depth interviews with the participants to understand their experience with the process. And all of this information and conversations that we've been kind of gathering is now being formed into a toolkit, which is a series of resources, like I said, that we're hoping can help these cities as well as others to do this work. So just real quick, some of the things that we heard from them. This was a very small sample, so this isn't a quantitative analysis, but just to give you a sense of what these cities were dealing with when we first started working with them. So most of them thought that increasing food system resilience was part of their job. So that was good to hear that they were, at least it was on their mind. More than half, though, said they didn't feel prepared to coordinate their city's response to a crisis. And this was as they were kind of getting right into the pandemic response when we talked to them. Half of them said, yeah, we have resources to work on this, but there are barriers. And they kind of, all of them agreed that they thought this work would improve their ability to coordinate food system work during future disruptive events. But they had mixed support from their governments and from their mayors and city councils for actually doing this kind of work. And they mentioned a number of barriers to doing this food system resilience work. The highest ranked one was funding, which is not surprising, but also staff time. The people who are working in offices of sustainability or health departments at the local level are very stretched for time. And especially during the pandemic, when they were kind of dealing with daily response, they didn't have a lot of time, but they also thought that there wasn't much time for thinking about kind of longer term solutions. Another barrier was just getting enough buy-in from government leadership to do this type of work, needing to know more concrete examples of what works and what doesn't work. How do you actually do this? And then they said we could use some technical assistance on this and a couple of other kind of challenges. And so after the actual kind of 6 calls and workshops with the cities, we pulled out some key themes that we kept hearing from the cities. The first one was that relationships are key, but somebody said we collaborate at the speed of trust. And this relationship aspect was just very, very strong and important. And again, when we saw what Baltimore City was doing, having relationships built in their community ahead of time was really important. And again, so community collaboration, guidance, and input are vital, and we need to co-create solutions with those who are most impacted by these crises and put equity at the center. Language matters, and there are a lot of definitions in this field that differ between different sectors, so it's important to be clear about what you're talking about. It's hard to scope out your food system, and food systems are complicated, so it's difficult to set boundaries on what you're talking about. But it's important to set goals, and this work is essential. And the harder and more complex systems work gets pushed off, but is necessary. And we heard from them that they appreciated us kind of having them sit together for an hour and 15 minutes once a week to think about bigger picture issues, because their day-to-day was so steeped in short-term pandemic response. They kind of were very appreciative that we provided a space to think about those bigger issues. So with all this information, we're creating this food system resilience toolkit, and the resources are kind of presented as modules and categorized into 5 different themes. And we're trying to make sure that equity and justice are throughout the toolkit, and kind of we're consistently asking what impact does this have on equity and justice, and how is this particular tool or strategy going to support that, as well as resilience. And going back to those 4 questions that I mentioned earlier, the toolkit's kind of arranged around these 4 guiding questions that are important when you're thinking about resilience. And so we do have some guidance on how do you think about the scope of your food system and what are you actually trying to make more resilient. We also have some tools that help them walk through how to do a risk assessment and a hazard assessment, trying to identify those things that are most impactful on their food system. We help them walk through how to come up with different strategies for improving resilience, and then also have these equity and justice centered approaches kind of highlighted throughout the work. So I think I'm getting pretty, am I running out of time here?
Yeah, we're running out of time.
Okay, all right, I'm just about done. So overall, I would just say that so far the cities have been very supportive of this work, and like I said, grateful that they have the time to take on some more complex issues while they're dealing with the acute crisis of COVID. And so we are putting out this toolkit hopefully within the next month or two, and hoping to share it widely with any kind of local government or food policy councils, anyone interested in doing more of this work. So thank you all for listening today. I'm sorry if I went over on time, but I am happy to talk with anyone individually. There is my contact information. Thank you.
Thank you so much, Erin. Unfortunately, we don't have time for questions, but she has provided you with her email if you have any questions to follow up. And we will move on to the next speaker. Thank you.
Hi, everyone. Give me a moment to set up. Okay. Can everyone hear me? Great. Okay, so welcome today. I'm happy to be here. I'm here with my co-presenter, Megan Stradley. And today we will be talking about food insecurity among Black, Indigenous, and students of color in the US. And before presenting myself, I'm going to go ahead and let my co-presenter introduce herself.
Thank you. Hi, everyone. Thanks so much for being here. I'm Dr. Megan Stradley, Assistant Professor of Organizational Communication at Westchester University in Pennsylvania, which is about 45 minutes west of Philadelphia. And I've been doing research, particularly in kind of two different areas. The first being global food systems, looking at how individuals communicate about food security through policy. So using my research with the United States Agency for International Development to see how policymakers passed the Global Food Security Act, which was really the first food security policy of its kind that was passed in 2016, which was a very contentious time in the federal government. At the more micro scale, I've also been examining how individuals communicate about power and inequity in local food systems. So small farms, local pantries, food pantries and food banks, as well as more recently, looking at college students and basic needs in the college and university setting. So we'll be talking a lot about what that means in terms of what goes into basic needs and how food security is a huge part of that.
Thank you, Megan. And I'm Dr. Mariela Fernandez. I'm a new associate professor here at Clemson University. And my research primarily examines the environmental injustices affecting urban Latinx communities. Now, most of this research has taken context as related to the urban green space, but more recently, I found myself doing some work on food insecurity. I think it started when I first began examining environmental injustices in the rural context. And one of the primary findings was that we have migrant farm workers primarily in our farms doing much of the labor across the US to get all of us fed. And unfortunately for them, that means that they are also being impacted by the negative health impacts that is associated by being near the toxins and the fertilizers and such. I've also gotten involved more here at the university level with doing student engaged learning around the topic of food insecurity. So this semester, for example, we are assessing food insecurity on our campus at the college level, and we will also be assessing food insecurity in the local community. So while speaking with Megan, we were trying to come up with a topic that we both had an overlap and an interest in, and it seemed like the college student population was really something that resonated with us. So we will talk about this throughout the presentation, but we will bring our unique findings to this presentation. So our objectives are also 4 major questions that we will answer, which is, what is a food system? Why is a food insecurity a major cause of concern for colleges and universities? What are the major research points regarding Black, Indigenous, and students of color? And what are universities doing to address the situation? Now, this is just a reminder of what the food system is. So I did borrow this nice food system map. I really like this one, but I will say that this one might be a little outdated, especially now that COVID is underway. So traditionally, this was called the food system cycle, which includes the food production, right? So when we think about food production, that's our farmers, our ranchers. So the individuals who provide our vegetables, our fruits, our meats. And from there, this produce goes to the processors to get ready and packaged to go out to the grocery stores and other retailers and get them ready for us, the consumers. And from there, there has been another unit, the resource and waste recovery. But just examining this cycle, it's a bit outdated, especially because during COVID, we saw how many grocery stores reduced the number of hours that they operated. Many of the restaurants had to close down for some time. So in this case, a lot of the food producers, whether it was the farmers or the ranchers, had to figure out how to get their produce out to the community. So how to get it directly to consumers and vice versa. So how can we get people to the farms and to the ranches and buy directly from them? So we will revisit this food cycle at the end of the presentation, just to kind of reiterate how this affects our findings. But we just wanted to kind of remind you of what this was, because we will be discussing it throughout. Okay. So the next question we want to address is, why is food insecurity a major cause of concern?
Thank you, Mariella. So I'm going to talk a little bit more about why food security is something that we're focusing on. We've been hearing a lot about food security, and I wanted to provide just a small bit of historical context that food security has been this term and this discourse that has been used for many years, 30, 40 years, especially in international institutions and organizations like the Food and Agriculture Organization of the United Nations, and other international bodies that talk about creating policy in order to help other parts of the world that may be food insecure. And it's only recently that in the US we've started to pay attention to food insecurity among our own population and among the people here in the United States, in our neighborhoods, our communities, and in our towns. And so I wanted to, show that this is quite a significant problem. As you see here, the statistic that nearly half of higher education students have experienced food insecurity over the past 30 days. And this is something that this is data that's been collected by the Hope Center that is now located at Temple University. But it's really only an issue that researchers have been paying attention to in the last 10 to 15 years. So certainly it may have been a problem in the past too, but we're noticing now that it's something that universities are paying attention to, and they're starting to address with institutional policies. And so thinking about food insecurity, and thanks to our very first presenter, Christina Barroso, mentioning that the kind of most severe form of food insecurity is hunger and malnutrition. So we noticed that this most severe form of food insecurity leads to hunger and malnutrition, which is of course not ideal for students that are trying to get a higher education degree, to get a better career, or to improve their own socioeconomic situation. And we see here that nearly a fifth of students face both hunger and malnutrition. Part of the reason that we are noticing more food insecurity, it's being talked about more and researched more, is that we have higher socioeconomic diversity among our higher education students in the US. So universities are quite a bit more diverse than they have been in the past, with universities providing more aid packages to families of lower socioeconomic backgrounds. And we also are seeing that more people may be taking classes from home during the COVID crisis, COVID pandemic. And that may mean that students that have come from a food insecure background may be shifted from an institution where they had food security back to a situation where they now face food insecurity at a deeper level.
And when we did this presentation, we really wanted to focus on the experiences of Black, Indigenous, and students of color, or BIPOC. We will say that this is not a homogeneous group. It does include African Americans, Africans, American Indians, Hispanics, Latinx. So this is a very broad term. And due to my interest in farm workers, we were trying to pull as much information as we could regarding the adult children of migrant farm workers who are now in college. But I will be honest, this information, this research is still limited, and it's in its beginning stages. But what we will say, for example, related to BIPOC students, they are more likely to be first generation students. And we do know that our first generation college students are more likely to be food insecure versus the ones who are not. Additionally, the BIPOC students are coming from households that may be low income. So of course, this will present some challenges accessing food. Regarding the adult children of migrant farm workers who are now in college, that in itself is pretty outstanding, given the unique challenges that they faced along the way. For example, coming from migrant households, that meant that their families were moving from farm to farm depending on the season of the crop. And that makes it really challenging for children of migrant farm workers to actually get an education that isn't interrupted. And because of that, they may either fall behind, but additionally, we are noticing that the children of migrant farm workers in the classroom, their teachers have had very low expectations of them. And what this translates to is in lower graduation rates. So when your teacher or professors don't expect much out of you, unfortunately, that does sometimes is associated with students disengaging from the education. So I would say that this population, the adult children of migrant farm workers who are now in college, really had to come a long way just to access college and universities. And now they're here and requiring social supports, and one of them being access to affordable and healthy food, as we will continue to discuss today. And based off what Megan said, and based off the information related to BIPOC students, what we are really seeing is that this has really repositioned universities from just providers of a service, in this case, education, to really providers of resources. That includes education, but also includes things like helping students with income, so economic, especially if they're coming from low households, accessing food, accessing shelter, and so forth.
Thank you, Mariella. So I wanted to continue with an example from some research that I conducted on, sorry, I'm trying to do my Zoom screen bigger. Give me 1 second. There we go. Some research I conducted with university students at California State University, Channel Islands, where I worked with students from all different backgrounds. It's a school that has majority Hispanic, Latinx, Latino, Latina students. And with this, with the study, we were asking students about historically marginalized students about their experience with food insecurity, housing insecurity, as well as resource or textbook availability and insecurity. And one of the students I wanted to excerpt in this presentation because I think it provides a nice example of what Mariella and I have been speaking about. So how being hungry certainly affects other areas of one's life. So Elena, the participant, and I'm using a pseudonym here to protect the privacy of this individual, she said in our interview that being hungry in class sucks, right? I've definitely sat in class hungry before because I didn't have the time to get food, or I didn't have the means to get food, or I didn't have anything at home. And that really affects your focus. You get tired, you're working to make that money as well. So you get tired of doing that and you come to school. You don't have enough time to do your homework, to focus on, what you're trying to learn that day. But it's something you just get used to and work with it. So this quotation I included because it has several layers of things going on in terms of hunger and food insecurity affecting students from BIPOC, who are BIPOC and from lower economic backgrounds. So this student is talking about how being in a class is affecting her ability to pay attention to her coursework, to do the coursework in order to be successful in the class and to achieve her goal of getting a degree of higher education. But then it's also impacting how she's able to work in order to afford her housing, her transportation, and her classes. So I'm sure this is a relatable situation to a lot of students that are working 1 job, 2 jobs, maybe even more while they are taking classes as well. And then the last thing I wanted to point out is that this is something that the student mentioned was something they didn't actually think about a lot as a problem, that it was something they dealt with every day and they thought that it was normal and that it would be temporary. And so I know Mariella is going to be speaking about how food insecurity is often not a temporary situation, unfortunately, but that students were dealing with it and not necessarily talking about it or seeking out help from others. All right, so taking one step back to looking at the importance of food insecurity and defining it across this presentation as we're using these terms. I know we've heard about this in the previous presentations, but just to give a quick overview of the 4 pillars of food insecurity. The 4 pillars of food insecurity were established and developed by Food and Agriculture Organization of the United Nations, and this addresses access, availability, utilization, and stability of food. And to break down those 4 different areas, access means that you have the resources in order to acquire any appropriate culturally or religious appropriate foods. The availability of food, so whether you have a grocery store, a bodega, a market, something nearby that's providing the appropriate quantity and quality of food. And as we've heard in previous presentations, that COVID interrupted that process, much as future disasters may interrupt that process. Utilization is making sure that every individual has adequate nutrition, including the appropriate diet for their bodies, clean water, and sanitation and healthcare, all kind of holistically to provide health for the individual. And finally, stability is making sure that you have those first 3 pillars over time. So making sure that those things are consistent and that they are consistent over time. The one other thing I wanted to point out and add to this group of pillars is the fact that our social interactions matter, our language matters, and that communication binds these 4 pillars together, right? How we talk about food insecurity and how we manage food insecurity, because we live in a social world, right? Within social institutions, and have to navigate different kinds of organizations in order to have accessible access to food, to find available foods, to utilize those foods in a way that makes sense and that we're educated about, and that those things can remain consistent over time. Thanks, Mariella.
Now, the next section of our presentation will discuss the major research points regarding BIPOC and food insecurity. And the first major point we wanted to discuss is that food insecurity doesn't happen alone. So if you remembered, I had mentioned I do an environmental injustice, right? I focus on that. And what this lens has really helped me do is see how all the injustices are related. So in this case, we do see that students who struggle with food insecurity don't just struggle in that area. So they are also struggling with housing, they are struggling with transportation, they are struggling just with funding. So why does this matter? Well, we know, for example, housing. If you don't have a house, you don't have access to a fridge or you don't have access to a stove. In the case of our students, some of them are required to live on campus, especially as freshmen. So in most cases, this means that they will get a small little fridge. I think we've all seen them, and perhaps a microwave. So in that case, the students have to learn to adapt and learn how to cook without a stove. This presents kind of a challenge, especially for BIPOC students. And, if we think of also the adult children of migrant farm workers, because think about the cultural foods and cultural amenities that may be limited, especially without that advanced preparation. So how to cook, salsa in a microwave. It's probably doable, but it becomes a bit more challenging. And transportation, right? If you don't have access to transportation, it's going to be really hard to get to a grocery store. I have had students who take the bus to the grocery store, and they will mention that this significantly reduces the number of items that they are able to purchase in one trip. I was also telling Megan that around here in the community, we do have some migrant farm workers and some who were working in the meat factories. And as far as their, students or college students, if they come to us and they are Hispanic and they need to cook, some Hispanic or Latinx foods, the closest meat markets that cater to the population would be about 40 to 45 minutes away. So if we think about transportation and accessing that food, it becomes a major problem. And well, on top of this, our BIPOC students are already struggling with a general sense of belonging. So they don't see their cultural, factors represented here. They don't see professors who look like them. The other students may not look like them either, and they may get the feeling of being unwelcome or even face discrimination. So again, what we're seeing is that food insecurity is just a very small piece of that puzzle of really the structural inequities that are set up against BIPOC populations. And according to this, the Hope Center does mention that about 3 out of 5 students were resource insecure. So again, this includes that they are not just food insecure, but they are also facing issues in housing and transportation. The also trend that we see is that not only does food insecurity not happen alone, but it doesn't happen overnight. So again, I mentioned the adult children and migrant farm workers. Some of them live in rural communities. And what we know about this population, for example, is that they are food insecure. They also have access to high calorie foods that may not be the healthiest. Right? This is very common to other BIPOC populations as well. And of course, they are living in households with high poverty, right? So this is a general trend that has followed them throughout their childhood, through being a youth. And some populations kind of hope that once they got to college, things would change. But in college, some of our students are also facing food insecurity. And Megan's going to tell us a little bit about the picture on the right.
Yes, so this picture is pointing to, as Mariela mentioned, the fact that food insecurity doesn't happen alone. And so thinking about not only our social interactions and how that impacts food insecurity, but our environmental interactions. So knowing that Many migrant farm workers are exposed to more environmental toxins such as pesticides and insecticides, but also unhealthy working conditions. So here on the right, you see a picture of a very smoky, cloudy sky. This was during the wildfires in Southern California in the fall of 2018. And while I was at CSU Channel Islands, we had a day where we had fires near campus and campus was evacuated. Many other businesses and organizations in the area were evacuated. Yet farm workers, who were often parents of a lot of our students at CSU Channel Islands, were continuing to work in the fields without any sort of protection or without any sort of release or information about how their exposure to this wildfire smoke would impact their health. All right, so moving from food insecurity and its connections to others, I want to touch upon the important concept of stigma and food insecurity. So stigma, for those who are unfamiliar, is really all looking at a way of othering people in our world, right? It's making judgments and characterizing other individuals, marking them with some kind of quality, characteristic, or identity, often referred to as a spoiled identity. So with the history of stigma, individuals used to be marked physically with some sort of brand or burn, for example, if they were caught and punished for stealing or some other illegal action. But now we use it more as kind of a way to point to the signs and symbols that can mark us in certain ways in our culture. And so stigmatization is this communicative practice of framing, blaming, and shaming that casts suspicion on the motives, intentions, and moral character of other individuals. And often this process has the effect of silencing individuals so that they don't feel like they can seek out help. They don't feel like they are deserving of aid or of help or of the right to food, for example. And a lot of this is not because of the individual's actions, but actually because of larger economic burdens, right? So larger trends that are going on across the world, whether that's the Great Recession that happened between 2008 and 2010, or other compounding crises. And stigma has the effect of leading to psychological burdens, feeling that you may have to do it all in order to provide food for yourself or your family, or for people that you live with, and making sure that you are able to, that you're making sure you're able to provide anything for others. So this leads us into the fact that stigma and food insecurity are tied to this idea of food as a marker of health citizenship. And what I mean by this is that we often see individuals, whether they come from low socioeconomic backgrounds or not, as specific kinds of individuals depending on the choices of food that they make. So often food can be highlighted as something that we can choose, that expresses our values, and we judge others that don't share those same values. And because we see food as so important and such a crucial part of our lives, if we make the wrong social or cultural choices, this ends up erasing who we are holistically as individuals, right? Other characteristics that we might have, other ways that we might be contributing to society. And so Rebecca De Souza, in her book, The Voices of Hunger, talks a lot about how this is set up by forces of racism, forces of class inequality, as well as unhealthy environments, which we've mentioned, especially for migrant farm workers that we've both looked at. And I wanted to use another excerpt from a series of interviews I did with food pantry clients. And this was from some work I did at the University of Missouri. And this individual, I think, is talking more about how she felt stigmatized for using the food pantry. And so she talks here about how she thought other types of these services were for the homeless, right? For people that didn't have a home, that didn't have a place to live. And she emphasizes that she had the majority of her normal food. She says, I usually have food stamps, and so it's normal that we don't ever go to food banks because I figure they're there for the less fortunate. And so I actually feel kind of bad for going. I think there was probably a little shyness just due to the fact that I was in a food bank and I've never been in one. And like I've said, I've always thought it was for people that were less fortunate than I. So I felt kind of bad for being there. This repetition of feeling bad, feeling guilt, feeling shame even about using a food bank that was free for anyone that came in, I think is striking because it shows how important it is, the types of cultural conversations we have about organizations that are there for food access and food availability. And so I wanted to continue on, and I think that Mariella, let's take the next one. Oh, no. Yes, so this ties very much to the hunger industrial complex. So noting that the organizations like food pantries and food banks are given a lot of surplus food from corporations that are able to donate foods without any sort of, or they're given financial incentives to donate foods from local governments, and they're given protection through the Good Samaritan Act in terms of the quality of the food and when it's given out to individuals. But it shows us that this cycle of having surplus food that's often made from processed commodity crops, industrialized meat sources, industrialized dairy sources, are often not full of the nutrients that many of us need in order to live a full and active and healthy life. And so we see this hunger as not a personal issue, but as a societal issue, and that we end up normalizing poverty, much like the first interviewee, the student from CSU Channel Islands did, normalizing this food insecurity and certain aspects of need.
Now, when putting this presentation together, we really wanted to dig a little bit deeper to the root causes of food insecurity. And although we could talk about classism and racism, what we really wanted to focus on for this presentation is the neoliberal approach of universities as one of the major causes of food insecurity. So for this, we can think about the corporate model of education that universities have adopted, particularly when they have lost funding at the state level. So with the decreased funding, that means that some of the costs have been pushed on to students. So we have seen this in the increases of tuition, and while students have had to pay library fees, rec fees, if they're freshmen, they have to pay for their dorms. They also may have to be required to pay for a meal plan. So this really brings in the bootstrap narrative, the pick yourself up from the bootstrap narrative, because this means that our students, especially our BIPOC students, are now responsible for acquiring all their resources. Now, this really represents a shift, especially from where some of them were growing up. So the students who were coming from low-income households, for example, things like accessing food that may have been taken care of through either the youth programs that they attended or even the schools that may have had a reduced or free lunch program. Their families may have also accessed food from the food pantries, from churches, or parents may have even been eligible for SNAP services. But now that they are in college and that they are now over 18, we see that some of those options no longer work. So they, of course, cannot get the free food from their schools or from youth programs. So this has required definitely for students to really think about how they are going to acquire the resources. And because of neoliberal approaches to education, we often don't see this as, there may be some discussions on whether universities are really responsible for this or not. And after this section, me and Megan will present some possible solutions that universities can adopt, particularly initiatives that are being used today. And these are we'll discuss whether they are Band-Aid solutions or whether they get to the deep cause of food insecurity. But before we get there, Megan does have a couple comments related to neoliberal universities.
Thank you, Mariela. So this just is pointing us to the fact that that in order to move beyond some of the stigmatization, to move beyond growing food insecurity, we have to focus on transcending the current solutions that we have to food insecurity problems. So as Erin was mentioning in the previous presentation, right, thinking about that more radical solution of getting rid of food pantries or moving beyond food pantries at some point might be a way to navigate the food system in a different way, and in order to alternatively address the food needs of all, right, to have it be a more equitable way of accessing food. I also want to touch upon food sovereignty, which is often placed in conversation with or paralleled with food security. So food sovereignty is a much more radical perspective that focuses on dismantling corporate agri-foods industry, monopoly power over food, as well as redistributing land and giving community rights to water, land, and food, right? Having it be based on more democratic systems that would allow individuals to take control over their food supply. And this is all about the human right to food rather than kind of reliance upon these built-in structures that we already have, relying upon industrial farms and industrially negotiated exports and imports between countries across the world.
Now, we didn't just want to bring up the challenges, we also wanted to present some possible solutions that colleges and universities are using to address food insecurity. So these are not all of them, but surely some that are more common. In all of these solutions, I think one of the biggest components is the idea of partnerships. So some universities and colleges are partnering up with local grocery stores and even with farms. And they're doing so in order to get these entities to donate some food to the universities. So before food gets old or unusable, universities are asking for them to be donated so the students can use them, or so the dining halls can prepare them to give out to students. And this is also related, for example, to the dollar lunches. So this was an idea implemented at the University of Kentucky after the students went on a hunger strike for basic needs. Now, in the dollar lunch approach, it was students receive an entree and 2 sides. And the dollar lunch approach is really, after the idea of fast foods who have a dollar menu. So students also wanted a reasonable and cheap, right, fast food lunch approach to getting their food. And for something like this to be possible, it really relies on the use of partnerships with the grocery stores and with local farms. And again, we also wanted to discuss BIPOC students and the adult children of migrant farm workers. That at the moment, what we see is that some of these solutions have yet to catch up. Some of the solutions we see is the slow introduction of cultural foods in the dining hall, right? It's still unclear whether pantries on campus carry cultural foods, especially I think the focus has been on just getting food, but in some areas they have been able to advocate for more cultural foods, and that is to address the needs of our BIPOC students.
And continuing on with some of the university approaches to food insecurity, a lot of campuses across the US have started campus gardens. Here at West Chester University, for example, faculty members received grants to start 3 different gardens around campus, and they utilize student volunteers to tend, to grow, and to harvest the produce that is produced. And then they utilize those products from the gardens in our resource pantry, so that we have a fridge and freezer, and that students can have access to some fresh food that was grown on campus. One of the critiques of this approach is that it is still continuing to rely upon free labor as well as voluntary labor, and that students aren't being necessarily reimbursed or being recognized or acknowledged for this free labor on campus. The other solution we wanted to point to around food insecurity was an organization called Swipe Out Hunger, which helps universities work with their dining services, the dining organizations that they partner with, in order to utilize leftover meals on students' meal plans to subsidize and give out meals to other students that may not have enough meals to cover the full semester or full year.
Now, I don't want to run out of time because I'm looking at our watch. So we did want to open it up to the audience to ask what are some sustainable approaches that deal with the root problem. And the solutions that we mentioned, one of the things that we thought about were that this is kind of an immediate solution to providing food to students, but does it really address the root problem and whether these solutions would really be sustainable? So we were interested in what the audience, if you have any experience with universities and colleges and what sustainable approaches are being used.
Thank you so much, Dr. Schradley and Dr. Fernandez. We had some great questions come in. I'm hoping those comments come in as well. So I'd like to start with one question that an audience member posed. So universities typically have like a meal plan or a dining plan or something like that. How is that playing into food insecurity? Is that covering people, or is that lacking in some areas?
Mariella, I can start out with the response. So I think food plans and meal plans on universities can be quite helpful for students if they know that they eat a certain amount and that it'll cover all the food that they need to eat for the semester. But often we're seeing that the companies that universities partner with, like Compass, like Aramark, are for-profit organizations, even if the university is a non-for-profit or a state-funded organization. And so often the meal plans are quite expensive, and students do not have the funds perhaps to cover maybe more than 1 year of meal plans, or they're having to work extra hours in order to afford the meal plan. So it can be a tricky situation if students don't have enough, and they would probably honestly save quite a bit of money if they made food for themselves. But again, putting the labor back on the student to individually be responsible for covering their meals and their and to have a certain amount of knowledge to cook healthy meals for themselves.
Yeah, I will add on to that. Here at our university, our food pantry on campus has worked to get the university to donate some, it's called meal plans, right? So they get about 50 points, and that is X number of meals. So if our students are really in an emergency and they really have no food, they would go to the food pantry and ask for this. We are also seeing at end of the semester, students may have leftover meals. And so universities are asking for the students to donate this into a pool. So whenever students are facing food insecurity, they can take advantage of some of these leftover meals from previous students.
Well, thank you so much for that insight. We also have another great question from an audience member. Do you all have plans to track how this temporary expansion of SNAP to work student eligible students will affect campus food insecurity? I'm sure there's barriers, but we can be hopeful there.
I will say we are barely at the initial steps to assess food insecurity on our campus. And here, SNAP was so recent that we are discussing whether to include that. And I think that would be an excellent suggestion. Just by talking to my classes and my students, they have no idea that this happened.
Yeah.
So I think a lot of educational campaigns need to go on, especially to educate them that this resource is now available and how they can access it.
Yeah, and just to add on that component of communication being so important to helping students know that even resource pantries exist on their campuses. I know here at WCU, we introduce it in their first year here on campus, but we have a very large commuter population who may not know where to access those types of things. So it's understandable that they may not know that the SNAP regulation has been adopted or passed. So it is a great suggestion to incorporate that into future research studies.
Great, thank you so much. And then another question that we have, this might be the last one we have time for, but we'll see. Have there been any policies that have been in the works or that have been implemented either at like the state or the federal level that kind of has this topic in mind?
There have been discussions, but they're still pending. So I mentioned the national school lunches, right? Whether those are free or reduced lunches. There have been discussions of how that would look like at the college level, but it is yet to be implemented.
And in Pennsylvania, there is a push for a hunger-free PA, which has been a resolution that's been introduced to our state at the state level the past few years, but has not passed. But certainly calling local senators, local representatives, if you are students or if you're faculty members or researchers, is a good first step to letting them know, letting your local people know that this is an important issue.
Yeah. And I'll finish off by just saying, I'll have to get the name of the national level, but the adult children of migrant farm workers is a population that is starting to get attention. So a lot of this, there have been initiatives created at the national level so that they get the economic resources that they need, whether this is financial aid, which again is actually one of the primary ways that universities are dealing with this sometimes. They hope that by giving students financial aid, it will take care of some of the issues related to food insecurity. So it's still at the very beginning stage, but there are some policies related to this very specific population.
Yeah, and yeah.
Oh, go ahead.
The last thing I wanted to make sure I got in is that, you know, we've been talking a lot about hunger and food insecurity and nutrition is obviously a huge component of making sure we have healthy populations, healthy students, et cetera. But that food security is not just about nutrition, right? It's also about culture as well as emotion and social well-being. So how we relate to others and making sure that that is addressed as well, not just having enough of things.
Yes, and that is a great point. And I very much value the input and the information that you have given everyone today on this topic. So now we will be going into a 10-minute break.
Good afternoon and welcome to our Central Centering Cultural Foods and Diverse Voices panel. Today, we have 4 wonderful panelists who will discuss topics related to the importance of cultural foods for different communities and the intersection of food inequalities, and food access in marginalized groups, among other topics, of course. Today, we will hear from Andrew Acapong, Bianca Moran, Adante Hart, and Reina Gascon Lopez. Without further ado, I will turn it over to Andrew Acapong. Andrew, please take it away.
Hello, everybody. My name is Andrew Acapong, and I'm a registered dietitian from Minneapolis, Minnesota. And I work as a corporate dietitian for McIntoons Fine Foods, which is a grocery store. You don't hear a lot of dietitians who work in the retail setting, but we play a very unique role in supporting the community and providing them access to foods, as well as the healthcare that they're looking for.
So now, Bianca, would you like to make introductions?
Sure. Hi, I am Bianca Moran. I am a curator of public programs at a nonprofit organization called Active Cultures based out of Los Angeles. And we work at the intersection of art and foodways to bring public programs to communities around the intersection of the arts and foodways.
Thank you so much, Bianca. And now, Adante.
Hey, can you all hear me?
Yes.
Awesome. Good afternoon, everybody. My name is Adante Hart. I'm a registered dietitian out of Durham, North Carolina. My work lies at the intersection of nutrition, public health, agricultural, culinary, education, and social justice. I wear many hats. I'm a health programs manager for Ruby, the world's leading online cooking school, where I leverage my background and expertise in food and nutrition to help steer the company's health and wellness related programming and initiatives. I also serve as the ambassador for Old Ways African Heritage and Health Program. Old Ways, for those that don't know, is a Boston-based nonprofit that promotes the idea of health through heritage, highlighting different cultural foods and their importance in a balanced diet. And last but not least, which I'm going to talk a lot about today, I work for Tallgrass Food Box, a community-supported agriculture business based here in the Triangle in North Carolina that sources the produce for our bi-weekly produce boxes from Black farmers in the state, from over 15 Black farmers and growers here in North Carolina. And I am thrilled to be here amongst my panelists this afternoon.
Thank you so much. Andrew, so please let us know, inform us, what do you do in the community and what does it have to do with food access and food insecurity and traditional foods, etc.?
Yes. So as a grocery dietitian, one of my responsibilities is to figure out as a business what kind of products and resources we can provide to different members in our served areas. And so the cities our business is located in, we target a lot of different income levels. We got very wealthy people to very low income. So when I'm collecting data from our sales report, I'm able to track and see who's using WIC, who's using SNAP benefits, what kind of things that they're buying, including for our online shopping platform. And so what I like to do very often is request from our community members, our shoppers, what kind of things they would like to see in our store that would make their shopping experience a little bit better and maybe make us a one-stop shop, so that way they don't have to travel so far. For example, in our rural communities, we are the only store that they have access to, and the closest store that they would have to go to prior to us moving into their city was about almost an hour to an hour and 30 minutes away. So it's important for me as their dietitian and as a company to be able to figure out how we can support these different communities. And also each location, each store that we have also caters to specific populations. So for example, at one of our rural communities in Montgomery, Minnesota, we have a very big population of Latino and Hispanic members. So we try to carry more groceries in that store that caters to that specific community. Or Lonsdale area, we have a very big Somali population, which is really surprising. And so we bring in a lot of goat meat, a lot of lamb meat, products made from those animals to kind of fit their needs, and even things like teff flours they could make injera. And then our main location in the inner city of Waconia store, we've been seeing a lot of people from Myanmar moving into the surrounding areas. So trying to figure out how we can bring in more of those Asian goods in the store, whether that's sticky rice or bok choy or a sort of different types of curry powders. So that way that individual doesn't have to travel, say, an hour into Minneapolis or something to kind of get those groceries when we're here for them, probably 15 minutes away from their house.
Thank you so much, Andrew. Reina, I didn't get the opportunity to introduce you. Do you mind doing some short introduction before we hear from Bianca?
Yeah, my name is Reina. I am a chef and food blogger in Charleston, South Carolina. Originally from Puerto Rico. My dad was in the Navy, so we moved around a lot, and we ended up staying here. There is a growing community of Latinos in Charleston, not many, so I like, cooking and sharing recipes to kind of stay close to my culture and kind of a way to go back home without hopping on a plane. So.
Sure. Thank you so much for your introduction. Bianca, we would like to hear from you. Tell us about your work with food access, traditional foods, cultural foods, etc.
Yeah, definitely. So part of my work entails creating public programs that bring to light issues around foodways, whether that be the histories of food and the intersections that they have with gender, race, geography. And so really what I try to do when I'm curating public programs is to bring to light and highlight not just different actual food ingredients, but the histories behind them, the roles that they play within specific communities, and really to approach my practice through kind of a decolonial lens and making access to stories and histories and these intersections really to highlight them and to bring in community so that we can have conversations and share within our communities, to share both meals, to share dialogue, to share stories, and to build community through hospitality. Our organization also works with artists along with food practitioners. So oftentimes our public programs will be conversations between artists and scholars, artists and writers, artists and food workers, food practitioners, chefs whose practices are in line with the ethics of our organization, to really think deeply about the complications that arise from food waste systems, and to really kind of root our practice in a historicity around the intersections of foodways and to highlight those. So that's what my work entails. I was a former teacher, so a lot of my practice has shaped my experience in the communities that I taught. So I use that oftentimes in thinking about public programs and to try to bring community in and have those conversations.
Thank you, Bianca. I do have a question for you. I was very interested to read about the connection between art and food. Can you talk to us about what your work is specifically about?
Sure. So oftentimes what we do, what we try to do and what I try to do in my practice is look for practitioners and artists whose work addresses issues around food justice, social justice, foodways, and history. So for example, we are working with an artist now, a Nigerian artist, and part of her practice is thinking about African botanicals and the histories of African botanicals and how oftentimes these histories are read as kind of they kind of erase the history of the African diaspora. And so her practice is really bringing to light the ways in which the African diaspora and African botanicals have made their way to the Americas. So it's conversations like that and artists whose work represents that. We're also working with another artist from South Carolina, actually, whose work looks at indigo and the history of indigo in the South and what the kind of the historical ramifications of indigo, right? And so we're not just looking at issues of actual food ingredients or access, but thinking about the histories of how foods travel from one area to the other, the interconnectedness. I also did a program with Reina not too long ago, thinking about the ways that the African diaspora has shaped Latinx and Latino foodways, and how oftentimes we attribute ingredients to another source, but we really need to think deeply about the histories and have conversations about how we arrive at dishes that we share not only with other cultures, but that are actually derived from the African diaspora, right? And what that means about the conversations that we're having amongst family, amongst friends, amongst our communities about those shared histories, as opposed to erasing those histories. So a lot of our work at Active Cultures is intertwined with that, thinking with and through artists' work who address those kind of issues and building public programs around that. So I hope that answers your question.
Yeah, it did. And it sounds quite interesting to me as an immigrant. Definitely, I understand the value of understanding where foods come and where they come when they come to our table, right?
Exactly.
But we will have conversation about that. Adante, do you mind telling us about your work?
Sure. I would say that a lot of my work centers around this theme of agency. It's something that the word has been said a lot of times during this colloquia. And this whole notion of people having more control, power over their food systems, their choices, et cetera. As a dietitian, someone who is a known expert in kind of food and diet, a lot of my work kind of centers around giving people that agency around their food choices. And so for me as an educator, through Old Ways, we teach a lot about the African diaspora, the diet of traditional Africans, as well as those part of the diaspora. And so the main part is called The Taste of African Heritage. It's a 6-week course where we talk about different aspects of the diet. So we talk about whole grains, we talk about greens, we talk about beans and rice. And a lot of it's just the plant-based things. We're not promoting veganism per se, but we talk more about the plants and the foods that are, a part of the diaspora. And so being able to not only talk about the nutritional value, which is cool, but also, like Bianca said, talk about the stories and where does this food come from? What does it do? What does it mean? What stories does this food tell? So being able to do that, and as well as, the cooking piece, which a lot of people love too. So being able to kind of merge those three is what I do, kind of an educator role, but also taking time to listen and, seeing what people like, what foods are important to groups, because not all groups are the same. So being able to have that message, but then tailor to each group. And then for Tallgrass Food Box, it kind of, we think about farming in America. We think about Black farmers and farmers of color and some of the hardships they've gone through for ages. And, what we did, this was birthed out of the pandemic when the founders, when everything was kind of all falling apart and a lot of farmers didn't have a place for their produce to go. A lot of the restaurants were closed. A lot of the traditional distribution methods were shut down because of COVID. And so our founders who had relations with these farmers prior to COVID, they sat down and well, what can we do to make sure these farmers, have a source of income, that they have a way to get their produce to the people so people can eat. And so they came up with the idea of doing a CSA box where we would pay the farmers, in advance. People would pay biweekly for boxes. And that's how that started. And then so we do boxes on a biweekly basis, or we do week to week, or not week to week, but we do shares for a whole season. And we, like I said, we partner with more than 15 farmers in the state. And to date, we've paid them, more than $200,000. And we think about, like I said, we think about the history of Black farmers in the country having land stolen from them, being forced off of land, Jim Crow, a lot of unfair practices. And so we think about our farmers being able to financially support them is an important thing that we do. And we think about this agency, one of the biggest factors of that is the economic agency as well. So being able to support our farmers economically and provide food to people in need here is, a way we kind of include those foods and make an impact in this region.
Thank you so much, Dante. And I always see how many connections you are making from the previous presentations on things that we see in the research and now things that you are doing in the practice. And now, last but not least, I would like to hear from Reina Gascon Lopez. Can you tell us about you? I just want to let you know that when I share with my coworkers and nutritionists that you were coming to the panel, they say, many of them say, yeah, I follow her blog. Yeah, I read
Oh,
her.
thanks.
Yeah. So it was really exciting to have you here.
Thank you so much. Thank you so much. My work's a little bit different in the lines of everybody else's work. I actually had to pivot to food writing and blogging when the pandemic hit. I was working in a fine dining restaurant that shut down. So I tend to focus on more like restaurant culture, how, you know, Black and Latinos are treated in the industry, especially here in Charleston. There's a huge inequality with, you know, food service, especially during the pandemic, and how everybody is being impacted. I do share recipes on the blog, and I love writing about food and, you know, particularly Puerto Rican food, Southern food, and how they're all interconnected throughout the African diaspora. I mean, there's so many dishes that we all eat that just have different names and they're all the same, you know? So it's really nice to learn about that. I actually have a few things lined up next month with Fresh Future Farm. It's a local farm here in Charleston, South Carolina. And we're gonna be doing cooking demos on rice and how that's connected throughout the diaspora. And we're gonna be teaching the students about rice culture, about, you know, everything in South Carolina, the Low Country, and how that's kind of impacted the foodways. So I'm looking forward to doing that.
That's awesome, Reina. And it reminds me of a book that is one of my daughter's favorite, like Everybody Eats Rice.
Yes.
So I connected emotionally with that. So now I would like to start with some questions, and those are questions for all of you. I would like to start with a why question. So why are cultural foods and traditional foods important for the work you do? Who would like to start? Or I will call you by name. Reina.
I think that cultural foods and traditional foods are important to what I do because it's a way to honestly stay connected to my culture and to stay connected to my ancestors. It's a way of having, you know, part of my world here in South Carolina when I can't, you know, go down the street and get some platano or you know, find some pigeon peas or things that I can't really find here in South Carolina. And I think that sharing recipes and sharing part of my culture is a way to educate other people. I think it's a great way to kind of shine a light on how connected we all really are. And I think that's the reason why I enjoy sharing it so much, because it's like we're all at the same dinner table together and we're just enjoying each other's company and learning about each other. That's my favorite thing about it.
Thank you, Reina. What about you, Andrew?
I have to agree with a lot of the stuff that Reina has said too. Especially like for me, I'm Thai and Laotian, and our personal practice of food is all about community and bring people together and just sit around, share stories, and enjoy each other's company. And then at my workplace as a grocery store dietitian, there are so many different types of people that I'm trying to connect with, learn about them, and how I can better provide services as a dietitian, whether that's educating them on how to boil an egg, or working with somebody who's maybe from Indonesia and trying to learn about their food practices and have them teach me. So that way, if I ever run across another Indonesian grocery shopper who needs help with their nutritional needs or maintaining like their weight or figuring out how to cook a little bit more simply because their spouse has passed away, I can bring that knowledge in and provide that education. And one example I've had was when I first started in the retail setting at my current company, I actually ran into an Indonesian person who really wished that we could start carrying jackfruit. And for me, I love jackfruit. I grew up eating that, but that's something that I know our city has never been, exposed to before. So after learning about her culture and what they do with jackfruit, using my magic touch as a dietitian, work with our produce department manager and work with our vendors to figure out how we can bring in fresh jackfruit into our store to meet that customer. So we're not only meeting that Indonesian clientele, but then this gives me the opportunity to teach other people through cooking classes, food demonstrations, doing Facebook Lives, focused around jackfruit, and teaching them the nutritional benefits and how this can be, say, for example, a really great protein alternative for a lot of vegan or vegetarian recipes, or say saving the seeds and you could eat that like a watermelon seed or a pumpkin seed or use it as a flour. So using all these different cultural tools and foods and educating people to use it a little bit more than just eat the flesh.
Thank you. Bianca, would you like to go next?
Sure. Yeah. I mean, I think connecting to all of those things, I think that food is it's a really important facet of culture, right? And it's the way that it's one of the ways that we can offer knowledge and share knowledge and educate and inform folks. And I think if you think about food in the way that, it comes from land, right? And so land is always going to be connected to the ways in which we think about food. And I think it's really important to be connected to both our culture through food to empower ourselves and to kind of connect to what we're rooted in. But it's also really important, I think, as a kind of a conduit of knowledge and to think about what issues arise from access to land. And I think, as Adante mentioned earlier, about the ways in which people are dispossessed from land. And land is, taken from folks, and for what, to what end, right? And so everything can kind of be centered around conversations around food. And if we use food to not only build community, but to empower folks to think deeply about their own connections to land, to other people, and to inform them and kind of give them knowledge, I think that's a really beautiful thing. I think as a teacher, I teach my child how to cook, not only so that she can know how to survive and how she can, I think food is also a way, it's therapeutic, right? It's the way that some of us cope. And so to be able to think about connecting to our cultures through food and being able to cook and remedy, and to kind of offer ourselves a space where we can heal is really important. And I think cultural foods do that. And it's something that I think for me, as part of my work, is what I am hoping to share with other folks, right? And to get to share in that community, into building that, and also just sharing that experience and that knowledge.
Thank you so much, Bianca. And now you're next, Auntie.
Yeah, I mean, I feel like everyone else has already said a lot of what I want to say, but just to reiterate some things, food, like, again, it's more than just what we need to fuel our bodies. It's a vehicle for culture. It's a vehicle for these stories and things, and it's so important to folks. And even though I don't work in the clinical setting, I have many friends and colleagues who do, and they may interact with patients. They're often told, "Oh, I went to a dietitian before, and they told me, I couldn't eat my platanos, I couldn't eat, I couldn't eat these foods." And it's like, who told you this? And so being able to, again, for me, the word is agency. Giving people the agency over their choices and having them feel as if they can make that choice when they're living in a world where there's racism, living in a world where there's a lot of things that are out of their control. What can they control? It's their food choices. And so having them still that sense of pride in the things that they know they eat, like that's why it's important to me to be able to assist people in sticking to their cultural foods, learning about them. And then for me, on a personal level, when I started teaching these classes it was my own way of getting connected to my own African heritage. A lot of things I knew, but there was a lot I didn't know. And there's a lot of foods I just wasn't aware of until I started teaching and do my own research. And for me, that was fascinating because, I don't know, what tribe my ancestors come from, necessarily, but I began to look at these different foods and began to kind of piece different parts of the picture together. and just really start to appreciate my own heritage, my own culture, just based on, the food. And then from the food, I looked at the culture, the music, and everything else. And so again, we work with clients and patients, they're coming to us for, how to eat, for health and whatnot. And when somebody tells them you have to give up this part of yourself that's so important to you, it's like it's dehumanizing, really. It's humiliating. And so I don't want for anyone to have to feel that. So for me, being able to have people have a sense of pride when it comes to eating their cultural foods, is preparing them as part of a healthy nutrition plan, like that gives me joy. And that, it's one reason why I do what I do.
Wow, I really like where this conversation is going, because we are really opening the spectrum in regards to food access. When I hear words regarding to agency and empowerment and getting your traditions and history is really what food represents for many of us, right? Now I want to bring you to the other side of the spectrum, and it has to do with engagement. Engagement usually in community initiatives might be a challenge, right? So what are some of the strategies for bringing diverse voices into the conversation surrounding food access, especially those that may be hard to reach because of work, home, or even health constraints? Who wants to go? Andrew.
Oh, there we go. All right. So my company has a really strong relationship with a lot of food shelves and food banks in the area. And so when we plan out different events or say food drives, we like to invite people who volunteer for those food shelves and food banks, but also members of the community if they're comfortable. Because say, for example, we could, pack brown bags of like egg noodles and peanut butter, so much almost every day. But then we're missing out on a large chunk of a population who maybe doesn't really eat that on an everyday basis, or maybe it's not part of their cultural lifestyle. So it's very important for us as a company who trying to help support a lot of these organizations to have those diverse voices to come up to us and say, hey, I'm really trying to look for more Asian goods, whether that's fish sauce or curry paste or basmati rice to sticky rice, and we're just not getting that. Is there something you can do? And so we'll work with our vendors and reach out to a lot of other organizations who can jump on board and be like, hey, this food shelf needs these things. Can you do something about that? And a hospital that's actually just across the street from my company too, are trying to work on how they can manage reduce rehospitalization rates of their low-income diabetic populations. So the hospital, their dietitians and I are kind of teaming up, doing some research and investigating almost like a CSA box where I would come up with different recipes for different specific cultures and different disease states, and kind of give them some basic information and familiar ingredients that they're used to, and kind of give them some different guidelines like, okay, you're the type of person who cooks with the microwave, so here's how you can do it with that. Or you only know how to slow cook, so here's some tips for that, just to make sure that nobody's left out, and that way they can succeed and not fail and end up going back to the hospital because the hospital didn't do a good job giving them the education and helping them maintain their lifestyle after discharge or like an outpatient appointment.
Thank you so much, Andrew. Reina, would you like to go next?
Sure. Just to piggyback off of what Andrew said, I think the CSA box idea, is a great way to get people involved and to get food in the hands of folks who may not have access to it. Actually, when COVID first started, I actually partnered with a local CSA group here called Low Country Street Grocery. And what we did is provided recipes and fresh produce, essentially for all of the food and bev workers that were displaced when all the restaurants shut down. So it was a good way to kind of get food to people who needed it. There was, no cost to food and bev folks because we were all out of work. And it was a great way to kind of essentially use social media to connect with people who I wouldn't necessarily interact with. There's such a huge community of food and bev workers here in Charleston. It's a big tourism city. So I think it's important to, essentially use the space, use the knowledge that you have to amplify the issues that are happening. And I think honestly, using social media as a tool is a good way to do that. I mean, that's how we're all connected here. So I think it's really neat.
Thank you so much. Adante, I would like to hear from you.
Yeah, so in terms of my jobs, what we do at Tallgrass Food Box, we're a for-profit business, so we do produce boxes, on a subscription model. But what we also do is we do donate a portion of our produce to organizations in the Triangle that provide direct relief to individuals in the Triangle who experience food insecurity. So even though we do sell our boxes, we do set aside a portion for those, and whatever boxes that people don't pick up, we often, package that and deliver to those individuals as well. So that's what we do on that side. Other farmers in the area, they do the same. And, in terms of my other job with the cooking school, we do online classes. So, in terms of accessibility, definitely with the pivot to online things, it definitely reduced the barrier for some people who couldn't, make it out to a class, whether it's due to transportation or it's due to, just cost of entry. So being able to have online programming, old ways we switched to an online version of A Taste of African Heritage. So being able to do that definitely got rid of one barrier to entry for a lot of people who wanted to be a part of the class and experience the program. So that was another thing. And then another thing for me, well, even though I didn't do this particularly, I know farmers in this area who, they would take a portion of their produce and they would donate that to some of these charities. So a lot of farmers in the area, even though they were also giving their produce for CSA boxes and other places, they would often have a part of their crop to go to local charities and food insecure individuals. So yeah, that's on my end.
Thank you. Bianca, we would like to hear from you.
Yeah, so the question is about how to bring diverse voices
to the conversation about food access.
Right. I mean, so part of my work as a curator is to kind of research deeply and diligently the kind of folks that we're bringing into conversations, right? So for me, that work looks like reading a wide variety of sources and looking through, I guess, using social media to a certain extent, but really my work is rooted in a research practice. So I'm constantly looking and thinking about folks who are otherwise kind of marginalized from these conversations and who don't necessarily have institutional access or have a platform, and bringing them into the fold in the ways that I can, right? I mean, I work for a nonprofit arts organization. We're a small team, but I think that work is incremental. And I think things like this are the beginning of it. And so, even me being a part of this panel, I feel like I now have 3 other people who I can reach out to, who I know now have a knowledge base and have, experience and have things to say, and who are diverse voices, and I can bring them into the work that I do. So a lot of it for me is just really networking in a kind of professional capacity, and also doing the research, right? Reading folks who are writing or going and listening to people speak. I have actually, I remember a while ago, I had read about Adante's Tallgrass, right? Yeah, I had read about that, and it's on my list. I'm like, this is something that's interesting, and so it's kind of like that. It's always evolving, and it's always being cognizant of what's not being said. I think also is going and listening to the conversations that are happening and being really cognizant of like, oh, they didn't talk about that. So I'm going to find somebody who does talk about that, and then bring them into the conversation and build public programs around that. And a lot of times for me, those are people who are having really kind of conversations that are otherwise uncomfortable, or folks don't necessarily want to hear. But I really feel like that's part of my job, is to bring people who do want to have that kind of a conversation and engage in that dialogue, even though it may be uncomfortable.
Thank you so much. This next question touches on something that Adante mentioned before about what we consider a healthy diet, right? And the question says, cultural food preferences can often be forgotten when we think of what a healthy diet is. As nutrition professionals, how can we advocate for honoring our clients and community members' food preferences in the clinical and public health settings? Who would like to go first? Bianca.
I'm going to answer this as an educator because I feel like so much of my practice, like I said, is shaped by my time as being a teacher, right? And so one of the things that I practiced was a culturally relevant and responsive pedagogy, thinking about my actual students. And so in this case, it would be patients, and thinking about how to be really culturally responsive to their needs, right? And I think for me, as an educator, a lot of that work was around kind of decolonizing my pedagogy and decolonizing my approach to thinking about what I had been taught and what lens I was being taught through and what kind of language I had been taught to use around certain cultural practices. And so really, I feel like in these two fields are interrelated because we're dealing with publics and we're dealing with cultures that are not our own a lot of the times. And so for my advice and my kind of input is that really framing your practice around being culturally responsive and thinking about how you can upend systems and upend kind of institutional language and institutional knowledge that may be inherently, racist or inherently anti-Black or inherently anti this, because that's what we have been taught, right? Like we live in a country where certain information has been, we've been inundated with certain lenses and frameworks for understanding cultures. And I think a lot of that work is just is decolonial. It's really thinking about how we unteach what we have been taught to better serve communities that are unlike communities that we grew up in. Perhaps.
Wow, that definitely expands the role of a nutritionist, right? Who would like to go next?
I'll go. I mean, I'll say that everything that Bianca just said, I hope that we're recording this because a lot of a lot of dietitians, a lot of training programs need to hear what she just said. Because it's really that decolonizing that mindset, how we think of food, how we view food, how we view the food of other people. That's at the heart of the issue. When it comes to training, a lot of programs, quite frankly, they're not talking about these things. They're not having these issues. So I'm glad that, UT is having something like this where we can have this discussion. So, I mean, I just applaud you all for even having this be a part of this overall colloquia. So, because a lot of schools aren't doing that. And so it starts with the training. Where do these dietitians get there? When did they learn this from? What do they bring to them, to the program, to their practice? And so we can affect that they are the training piece, being able to have that decolonization, that education, because it's much more than food, as we've talked about all day. What are these stories behind this? What matters to people? And another term is cultural humility, being able to listen, understand another person's culture, what it means to them, what it is. You may not be an expert at it. You don't have to be an expert at it, but at least have the understanding, have that knowledge. And if you don't know, find someone that does and ask them, and read, do research. I mean, we're all, we're here in an academic setting. There's plenty of books and people you can talk to do those things. Not you, but the collective you. And also, when it comes to nutrition, a lot of times people hear, oh, Mediterranean diet this, or eat this way, eat that way. And it turns a lot of people off because it's like, oh, my foods don't fit in this box that you're telling me to eat. So I guess my foods are bad. But we need to look at it differently. We know in terms of, micros and macros, what the components of a healthy diet are. So we can then take those components and then look at what someone typically eats and be able to tell them, okay, so you eat this, this, this. Oh, actually, this is rich in fiber, or this is rich in vitamin K or whatever. So, hey, this is actually something that you include more of. And so being able to have that knowledge of different cultural foods, and that comes from education, that comes from teaching these things in different nutrition education programs, in our coordinated programs, being able to have immersive learning, being able to bring different people, and we talk about diverse voices, bringing those folks in who are more well-versed in a specific culture, bring them in to train and educate our future dietetics professionals on these things. And I'm gonna shut up in a minute, but the last thing I'll say is, there's a group out there called Diversified Dietetics. They are doing amazing work in the field, started by 2 Black women a few years ago, and they are doing awesome programming around increasing diversity amongst the ranks of those in the dietetics nutrition profession, but also increasing the knowledge, because like I said, not everyone's an expert in this. So being able to at least provide that education. They do different seminars, they do different webinars. We actually had one, I was on one this week where we had a farmer on and we talked about the link between nutrition and farming. And so those topics that aren't really discussed in programs, whether departments don't have the time, resources, or political will to do that, Diversified Dietetics, they do these types of programs. So being able to have that education and reach out to those people who do that, that's another way we can just increase this awareness and cultural humility so that dietetics practitioners can more effectively serve their diverse audience.
Thank you. Thank you. Reina, would you like to go next?
Sure. I guess from the standpoint of being a chef, I could definitely relate to what was just said, especially from the standpoint of decolonizing food. Being classically trained, the only technique that we learned in culinary school was French, and it's just like, why is that the end all be all of, elevated cuisine? And it's just like, I think that's what's important to me when I share recipes. I try to share food that we grew up eating. That's, I guess in the grand scheme of things is considered bad food, like rice and beans and plantain and things that you don't see in, 3 Michelin star restaurants. But the thing that I've enjoyed most is actually calling out the chefs who do that. And, the publications and the food writers, cultural appropriation, we saw the huge shift online just last year where people were, listening and learning. So it's one of those things that I think is important to address in the moment. And like Adante said, keep bringing in the voices, keep bringing in the people who are part of that culture, are part of the group, who are essentially experts in that field to speak up about it. I think, frankly, and this is my personal opinion, I feel like certain things should be gate kept. Like, I don't think that we need to elevate. There's nothing to elevate about cultural foods. I think they're special, and I think that they're important, and the cooking techniques are just as proficient as traditional, classic French technique. So
awesome. Andrew.
When I worked in clinical, and what was really frustrating to me is the lack of educational resources to give out to your patients or clients that are not only in their native language to help them understand it, but also using examples that they are familiar with in their own culture. And Adante could probably agree with me as a practicing dietitian as well, but say for diabetes education, yes, they could have Spanish versions of that, English versions of that, but regardless of the language, the handout is all the same. It's usually using examples of the Western diet. So I remember one example when I worked for a rehab facility, a doctor asked me to provide diabetes education to a person who is from Ethiopia. So I'm like, well, give me 2 weeks or so, because I have no education handouts that's in Amharic, the language of Ethiopia, or even examples of Ethiopian food to use as examples to help them understand what's a good portion of injera or some type of other food that they recognize and can understand and use to be successful. And so as, a BIPOC provider and really wanting them to succeed, taking the initiative and seeking out resources as best as you can, or just going out of the community, like I remember for this individual, I actually had to go to an Ethiopian restaurant, talk to an employee and be like, hey, I'm a dietitian, I need your help to create this handout for this person who has diabetes. Can you translate for me in writing, as well as give me some resources, so that way I can take this to that individual, use these pictures for diabetes education while he follows along with the Amharic written language on that handout. And so as practitioners or food professionals and whatever, we need to do our due diligence in talking to these providers and making resources like these accessible for people, so that way other people can use these tools and succeed with the population they're working with.
Awesome.
Can I add something really quickly also?
Sure.
I just want to, exactly what you're saying is a culturally responsive approach, right? And so in any circumstance where you're trying to give somebody information, whether it be in a classroom or in a hospital setting or in any setting by which you're trying to actually give somebody information, there are so many studies and so much research has been done on the ways in which the brain takes in information when it's culturally pertinent, right? When you're able to connect with somebody through the use of culture. And I think we need to differentiate here for folks who don't maybe understand the difference between race and culture, but cultural cues are quite important when you're thinking about communication and when you're thinking about the exchange of information. So precisely what Andrew is talking about, in that he had to take 2 weeks to go figure out a way for this to make sense, is precisely the kind of work that I'm suggesting needs to be done in relation to patients, right? Because cultures are different. And so the way that knowledge is absorbed, the way that knowledge is taken in and processed is so dependent and reliant upon the way it's given and what it is given, right? So, and culture is one way to do that. And like I said, there are plenty of studies done and so much research on education and culturally responsive teaching, training, and giving education.
Yeah, thank you so much. And like you guys said, I'm so glad that this session is being recorded because there is so much information that we can all learn from. We have been talking a lot throughout this afternoon about food access, right? And we have seen issues regarding not just to the financial constraints, but also transportation. But what about when you might receive a supplemental nutritional program, but the foods that you need are not part of that program, right? You cannot purchase them with that. I'm speaking about WIC, the WIC package specifically. So the next question says, are there any foods that can be added to the WIC package while meeting the nutritional requirements?
I'll let Andrew go. I'll talk about that since he's more so in the retail space.
Okay, so yes, definitely. So something that I do is I do work with a lot of our WIC clients in the counties that we serve very directly, and try to work with the dietitians and the nutrition specialists at the county WIC office to kind of figure out how we can tailor around their WIC packages and expand their benefits as best as we can. One of the things definitely that we need to do more of is advocating at a federal level and talking about maybe opportunities how we can change policies, because yes, we can talk about these at a county level, but if the federal government isn't knowing much about how important it is to incorporate more cultural foods, they're not going to change the WIC package benefits across the board. So one thing that we do for our WIC clients and even our SNAP Ed clients is, as a company for a grocery store, a lot of our WIC clients and even our SNAP Ed clients could apply for a grant through our store and then if they get picked, they get a lump sum of money throughout each month for the year to help them pay for any food, whether that's cultural foods or even maybe like diapers and clothing that they need to survive and meet their lifestyle needs. And then that's something that they can reapply for actually every year too, regardless. And you could get that grant, every year for life while you're on your WIC benefits, for example. So another example to kind of help them tie in to get their nutritional needs is, canned salmon or canned tuna is a common protein on WIC benefits. And say, they don't have enough to like buy beans or buy rice. And so something I do that a lot of WIC clients are really scared of is buying dried beans or dried rice versus like minute rice, for example, because they don't realize how far and how long that can actually go compared to like the minute ones, for example, and kind of teach them different combinations and how to expand that a little bit more. So like, okay, your Vietnamese on WIC benefits, how about we kind of teach you in a really easy way to make a quick, stir fry using your canned tuna and throw in some frozen vegetables and like your soy sauces, your fish sauce, any of those cultural seasonings, and serve it with your rice dish. So that way you have a little balance of like, your vitamin A, your iron, things like that. So teaching them these little tips and how to make it a little bit more nutrient dense, even if it doesn't cover a lot of the groceries that they're looking for. Does that kind of make sense?
Yes, yes. Who would like to go next? Rena, I know that you might have a lot of good ideas of things that can be included.
I don't necessarily have much experience with WIC, unfortunately, but I personally used SNAP benefits when I was in school. So a lot of the blogs and recipes and pretty much everything that I've shared was used with SNAP. So I think the biggest thing that I like sharing are budget-friendly recipes, pantry staple recipes, like Andrew was saying with like the canned salmon, the canned tuna. There's so many different things that people can cook by just shopping in their own pantry, going to food pantries. I visited a couple food pantries while I was in culinary school, living that student life. I was on a budget. So I think it's important to kind of shift the mindset of like super fresh, super, organic, like I have to go to Whole Foods and I have to get all these no, like you could eat canned vegetables, you could eat frozen veggies, you could eat canned fish, there's so many different recipes and there's so many different ways. I think we have to get rid of that stigma that's attached to eating on a budget, but I think that's honestly the first step to get that done.
That's pretty interesting. Bianca.
Yeah, I would say this is kind of a two-pronged question, right? So I think on the one hand, I'm a single mom. I used SNAP for years while I was in graduate school. I was in Los Angeles and in LA. I don't know if this is a federal and cross-country thing, but we were able to use SNAP at farmers markets. And so that was a huge positive for me, being able to go to the farmers markets and use SNAP. Now, I don't have direct experience with WIC, but I will say kind of this is the second part of the question, the answer to the question, right? In which that these are really systemic issues, and these are issues around the ways in which we think about who deserves what kind of access. And so ultimately, I think while we can think about this conversation like on a micro level and think about like, oh, how can we give this one family or this community recipes for how to use their WIC more efficiently or in more culturally pertinent ways. I think the larger conversation that needs to be had and should be, and folks should be advocating for, is really like on a federal level, rethinking the ways in which money is distributed to folks who need it, and to think about how to push back on those systemic issues and really rethink why we don't just feed people the things that they need, right? And why are we not giving folks enough money to actually survive? And why are we limiting what folks can buy with WIC or with their SNAP? I think those are the more important questions. And I think the more that we can kind of advocate and solidify and kind of mobilize around that kind of equity is really the answer to the actual question, right? Because sure, we can work individually at where where WIC is accepted. But ultimately, it's a much larger issue. And I think those are the kinds of conversations that I'm not more interested in having, but certainly ones that I'm pushing to have, in that what are the ways in which these are rooted in anti-Blackness? What are the ways in which these systems are rooted in anti-immigrant sentiment? What are the ways in which we are thinking about folks who are on WIC as less than deserving of folks who go to Whole Foods, for example? And those are philosophical, fundamental, ethical questions that I think folks in this industry need to be having, and certainly those are conversations that need to be pushed forward, right? And those are conversations that need to be mobilized around.
Thank you so much. Adanti?
Yeah, all of what Bianca just said, like 100,000%. You know, having these conversations is something we need to do more of, but not just conversations, but moving action. Andrew even said, you know, we need to be lobbying and advocating, you know, on Capitol Hill for these things. You know, a lot of us are in the field of nutrition or in public health. We need to write to our lawmakers. We need to write to the people who are over the USDA, people who govern these programs, to advocate for these changes, because it's not going to unless we start from the top. And that's actually what I wrote my master's thesis on, was this notion of food sovereignty in public health and nutrition, and how, you know, everything that we've heard about from food sovereignty earlier, it's all rooted in, you know, pun intended, looking at the root of the issues. You know, here in public health, we often look at the root cause. We often are concerned about the more upstream approaches to these more complex issues. Whereas when we look at food security, it's almost just like, all right, so yeah, there's these more upstream issues, but then like, oh, we got to get feed people now. So it's like, no, we need to like move the conversation further up and look at why things are the way they are. You know, why is WIC the way it is? Why is SNAP the way it is? And so we really, you know, it starts in our training programs in the collegiate level, being able to educate our students on asking those questions why, and not just saying it is because it is, but really like encouraging them and having them to push against the system and be able to say, all right, this is not right. This is, you know, this is effed up. How can we change this? You know, we need to like make some changes here. And so overall, we need to be doing more so that the advocacy on a larger level. I guess for more immediate response, I think Bianca and Andrew said, you know, it's the SNAP program, you know, farmers markets that offer SNAP benefits, pushing for them to do more of those. I know when I lived in Baltimore, the farmers markets there, they did the double bucks. I know a lot of farmers markets around the country do double bucks if you use EBT payments. So for every $1 you spend in food stamps, you'll get 2 at the farmers market. So pushing for more programs like that so people can get more for their money, and even pushing for some farmers markets that don't offer SNAP yet to do it. Here in North Carolina, we have a Black farmers market that started a couple years back, and they now have the ability to accept EBT and SNAP for their customers. And so that little thing right there, it goes a huge way for some of the patrons who come in and they want to buy things, but they have a limited budget. So now, because they have EBT, they can get more for their money while they're here. So definitely pushing for those programs. And if, you know, for those viewers out here watching, if you're a part, if you know, or you've frequented a farmer's market, they don't have those things, and you have those connections or have the ability to help them with an application to do SNAP, that's something that you can do. So helping those farmers markets and other groups that provide food to accept SNAP benefits, that's something that we can directly do to help. So yeah, there's a lot of overall systemic changes need to happen, but there are also a few immediate things that we can do as well.
Wow, I don't even know what to say. I can listen to you guys for hours. Unfortunately, we are reaching our time limit. However, I want to finish with a question in a more lighter note. I have a question here that would like to know more about you. We have a very, very diverse panel, and we would like to know more about your personal cultural food practices. It says, tell us more about unique cultural foods from your community. Who would like to start?
I can go
Andrew.
first. So as I said earlier, I'm of Thai and Laotian descent, and food is all about community, and it's all about all these tiny little small portions of a little bit of everything at the table that you share with others. And it's hands food. You eat with your hands, or well, soup obviously you can't, but there will always be like fresh vegetables and fresh fruit, different salads, a variety of different soups, usually two different rice varieties like sticky rice and jasmine rice. Depending on like the mood of the meal we're doing, maybe it could be a Thai Muslim meal. So we would have a lot of small curry dishes made heavily with goat and lamb meat and coconut milk, or maybe it will be something from my grandparents' village where they lived in the jungle where coconut wasn't very abundant. So it's a lot more like watered down base sauces, very bitter ingredients like bitter melon, riverweed, for example. And so we focus basically like Thai and Laotian cuisine is very, very heavily focused on the fresh fruits and veggies and herbs that are centralized in those various areas, and then centering all the other little elements around that. And so it's really fun having all these little different pieces and then just learning about them from like my parents or grandparents and what the story is behind it. And sometimes, you know, my parents, they grew up during the Vietnam War and they moved from refugee camp to refugee camp. So a lot of these recipes I grew up eating in those households were just stuff that they've thrown together because it was what was available. And so I still eat a lot of those foods today, and so do they, because it was what they had, you know, to survive. So sometimes with my personal story, there isn't actually like a cultural tie that's true to the Thai and Laotian heritage, but more so like my parents' struggles trying to survive in refugee camps.
Wow, thank you so much for sharing, Andrew. Adanti, we'd like to hear from you.
Yeah, for me, I'm born and raised in the South. I guess not really the South, because South Florida is really considered the South, is it? I don't think so, but I consider myself a child of the South, and Southern food is kind of that's where I connect to most of all. So for me, you know, it's things like the collard greens, cornbread, black eyed peas. That's my go-to meal, you know, on a Sunday evening. When I make that meal, like I feel like this sense of comfort, this sense of warmth, this sense of just like, this is like me. And that's just my favorite meal. But again, having learned more about my own African culture through teaching classes, you know, I've come to really have a strong appreciation for Ethiopian food. Like whenever I go somewhere or I make the food myself, I just feel that connection. And like the food Andrew was talking about, Ethiopian food is also one of those foods eating with your hands. You know, it's a more communal dish. And I just love, you know, of course, you know, with COVID and everything, it's a little hard to do this, but I love, you know, having people over, making a meal, having that injera lined out with all the different watts on the plate, and being able just to pull a piece of injera off, pull from here, and just eat and just have that shared communal experience. So for me, those types of things really bring me joy. It's the Sunday meals, you know, reminds me of my mom, my grandma, the people, you know, that raised me, and then also what I've learned from my college days onward, learned about African foods, so the Ethiopian meals, the things like the jollof rice, the tibujin, the yassa, all those different foods from Africa. So yeah, that's it for me.
Thank you so much. Bianca?
Yeah, I mean, so much of my kind of food experiences were shaped by my maternal lineage, right? So from my mom and my grandmother. So everything that I think of around cultural foods are actually really, I would say, more so shaped by the culture of women in the kitchen, right? And like that maternal lineage. So my grandmother went to culinary school when she was young. And then so for us, she cooked literally every type of food. There wasn't specifically anything that was linked to an ethnic cuisine or anything really specifically national. It was really just her cooking anything. Like she cooked mushu, she cooked freshman homemade lasagna, she cooked, you know, everything was fresh and made. So when I went to culinary school, I kind of think about the ways that she taught me how to cook through not just like specific dishes, but just her mechanisms, right? And I really feel like more than anything, it's more of like a kind of spiritual and ancestral connection and thinking about the way she's with me in the kitchen. And while I make things that she made, they never taste the exact same as she made them, you know, but I know I feel her spirit like in the kitchen with me. And that's kind of a cultural experience to me. It's like I make my daughter the same chicken noodle soups, we call it fideo, that she made me when I was younger. And that's a cultural staple in the sense like of my home culture. But really, I feel like more than anything, it's like these kinetic things, right? Like when I'm whisking or when I'm, you know, salting my food or those things are how I think I'm most connected to kind of cultural remnants of food, not necessarily specific dishes or anything like that.
Thank you so much for sharing. And I would like to close with Reina.
I have to agree with pretty much everything Bianca said. I look at cooking as more of a ritualistic, you know, ancestral thing. And I think it's so special. A lot of the dishes that I make are actually Puerto Rican. But living in Charleston, I have a very special connection to the Gullah Geechee cuisine. And a lot of the foods that we eat are actually completely interwoven with West Africa. So, you know, Adante mentioned jollof rice, and in Puerto Rico, we eat arroz con gandules, which is, you know, a stewed rice dish. It just has pigeon peas, which come from Africa. So, you know, plantain like tostones and maduros comes from Africa. Sofrito and, you know, all of the herbs and the aromatics, a lot of that was introduced with Spanish colonization. And then, you know, lechon and pernil, like all of the famous pork dishes that we eat in Puerto Rico, stem from the indigenous culture of the Taínos. So we're just this big, you know, mix of different foods and connections. So that's what I really love cooking. I cook pretty much everything because I am a chef. You know, I kind of whatever I want to eat, I just make it. But the foods that, you know, make me feel like a warm hug are just, you know, rice and beans, a pork chop, and plantain.
Well, thank you so much. We have definitely reached our top time limit. I deeply appreciate you taking the time to share with us, not just your knowledge about food access, but also your heart about food and how passionate you are in creating food access for your communities. I will turn it over to Cadence. Thank you. Thank you so much.
Thank you so much, Liliana and Bianca, Andrew, Adante, and Reina. That's been a great panel discussion. I'd also like to thank all of our audience members for their patience. I know there are some technical difficulties, but I believe what Twyla had to share was so meaningful, and it was amazing to see her in action. It just gives a new meaning to the idea of field work. So today we've seen how inequities affect every stage of the food system, but also how different individuals and groups are working to close the gaps and reduce barriers. We have great examples from various phases of the food system to follow, from Aaron describing local government programming addressing food security in Baltimore, to Dr. Fernandez and Dr. Shradley sharing intentional interventions such as $1 meals to improve food security for college students. Or Twyla Casadora reminding us that the call is to plant a seed of knowledge in a non-judgmental way, provide the resource, and let people have the agency to choose what to do with it. And finally, our panelists really driving home that cultural foods have always had nutritional value, and there's a true connection to mental well-being, a feeling of home, and overall health. I hope that we each leave this colloquium more knowledgeable about the inequities that exist and the resources currently available to address these barriers. I also hope that we leave this colloquium with the motivation to make equitable, inclusive, and meaningful change, and the commitment to sustain those actions. Thank you, and we look forward to seeing you in the spring.